are 5 ways you can help combat stigma and discrimination as we fight against coronavirus COVID-19. 1. Educate your friends and family that COVID-19 is not specific to any race, nationality, or skin color. 2. Do not associate migrants with the virus. In many contexts, migrants are healthy and key players in nation building. 3. Remind others that discrimination may lead people to hide their symptoms rather than seek treatment. This puts everyone else at risk. 4. Be kind, considerate, and helpful to others in these difficult times. 5. If you know anyone experiencing symptoms, encourage them to dial 1025 for free.
Hello, good afternoon, listeners. It's me, Suleiman Ben Suare. I'm hosting tonight's show. Good evening and good afternoon to the other locations in the world. Today is Friday, the 7th of August 2020. We have a live panel discussion on the Gambia and the COVID-19 situation. We want to discuss on our problems, prospects, and pathway. This is the part 2. We had the part 1 day before yesterday. And the program is organized by the Civil Society Consultative Team, comprises of myself, Elizabeth Ceesay, United Kingdom, Ndeye Jobate in Norway, Maimuna Tal in Canada, and Chernobyl in the US. And the program is hosted on Gunjur Online, and we are simulcasting with Fatou Radio and Diasporum and Gangainako. Sky Power will come on later with Paradise TV on their Facebook page, and with Gambia, with Capital FM on their Facebook, Capital FM in the Gambia, and in partnership with Gambia House Norway. Today's topic would be the Gambia and the COVID-19 situation, the problems, management, how to deal with all the elements during this period, and advice to Gambians from the media practitioners' perspective and survivor perspective, with leading Gambian doctors in the diaspora and the Gambia, and a member of parliament, the chair of the Select Committee on Health. We are going to have our speakers introduce themselves in a minute, but I would start by introducing the speakers we expect to be on the program today. Some of them are already here. And we have Dr. Fatoumatta Ceesay, pediatrician, doctor in Washington, US. We have Honorable Ousman Sillah, the Chair, National Assembly Select Committee on Health and MP for Banjul North. He is with us right now. And we have Ms. Fatou Kassama Saidy, a COVID-19 survivor, a resident in Minnesota, USA. She is with us here too. And we have Ms. Fatou Kassama Saidy. Sorry, we have, sorry, mentioned, not twice. And we will have Dr. Kebba Marenah, who would be joining us soon, scheduled to join us soon. And we are expecting Mr. Alhassan Senghore. Kebba Marenah is a medical doctor, practitioner in the Gambia. And Mr. Alhassan Senghore is the Secretary General of the Gambia Red Cross Society, GRCS, and former director Africa International Federation of Red Cross and Red Crescent Societies, IFRC. We are expecting to have Mr. Hamidou Camara, RN, a COVID-19 survivor, director of ER and ICU at the Garden City Hospital, Michigan, worked in the ER and ICU as a RN for the past 12 years, from Fatou village in URR, studied nursing in the US after attending St. Augustine High School. And again, we are expecting to have Ms. Aishatu Fatou Jagne, Public Health and Research Fellow at the CDC, Center for Disease Control in Atlanta, USA, and Mr. Kebba Samuel Nyanchor, PRO from Edward Fines Small Teaching Hospital in Gambia, Banjul, the Gambia. Assalamu alaikum. Good afternoon, good evening to some of you. You are welcome on the Gunjur online platform on our second segment, second program on this very important discourse, which is the Gambia and the COVID situation, this national emergency. We are glad to have you, and taking time from your busy schedule to come onto this important program. I would just ask you all to start from the Honorable MP to introduce yourselves to the audience briefly before we start the program. And I would say before we start the program, I would just want to mention that I noticed there might be some Sierra and Jolas here, and Sarahules and probably Kabunkas, but I give you permission today to speak your language. You are free to speak the language, and we want to encourage you guys to talk to our people, and we try and connect to them so that the advice will get to them. We encourage you to use any language you are most comfortable with, but we will be happy to have some of us who can express ourselves in different dialects to do that. I will leave the floor now to Honorable Sillah to introduce himself, and we'll take the line from there. Thank you, Mr. Sillah. Welcome.
Well, thank you very much, Suleiman Ben Suare. Thank you for having me on this second segment again, because I was also at the part of the first segment. As you rightly introduced me, I am Ousman Sillah. I am the National Assembly for Banjul North Assembly member, and also the chairperson of the National Assembly Select Committee on Health, Women, Children, Disaster, Humanitarian Relief, and Refugees. I am also part of some other committees like the Committee on Trade, which is a select committee, the Standing Committee on Foreign Relations as well.
Thank you
for having me once again. Yes.
Thank you. Thank you, Mr. Sillah. That was Mr. Sillah. Dr. Fatoumatta Ceesay. We cannot hear you. Your mic might be... Thank you.
Can you hear me now?
Yeah, we can hear you now.
Oh, okay. Assalamu alaikum. Thank you very much for having me. My name is Fatoumatta Ceesay, and I am a pediatrician, and I live in Wisconsin in the U.S. I am truly appreciative of the privilege of allowing me to be on this forum, on this panel discussion with such esteemed guests. I am really excited and honored, and I cannot wait to hear about everybody's input about this very important topic to be discussed. The pandemic obviously has rolled on to Gambia as it has all over the world, and it is very important that we talk about the many topics and the many aspects of how it affects our people in the Gambia. So I am truly excited, and I am looking forward to this discussion. Thank you so much.
Thank you very much, Dr. Fatoumatta Ceesay. We have Ms. Fatou Kassama Saidy. You're welcome.
Thank you, Ben. Good afternoon, good evening, everybody. Assalamu alaikum. My name is Fatou Kassama Saidy. I live in Minnesota, USA. I am a COVID-19 survivor, and I'm happy to be here today to share my experience. I am a mother of 3, and I'm also an HR professional for a manufacturing company in the US. Thank you for
very
having
much,
me.
Fatou. Thank you for taking your time. I think we have, let me just see who we have here again. Mr. Is it Kebba Marenah? Is that Dr. Kebba Marenah?
Good evening.
Good evening,
Kebba, and the panel. Thank you for having me on the show. I'm Dr. Kebba Marenah. I am an orthopedic surgeon by profession, and I work at the EFTHS in Banjul. I'm the head of Department of Surgery at the EFTHS.
Thank you, Kebba. Who do we have next? Would be I cannot see that. Can you project that name there? No, not Aji. The other gentleman. We have another gentleman in there. The other gentleman there. Okay, thank you. That should be Mr. Hamidou Camara, if I'm right. Mr. Camara seems he's having internet problems. Okay, Mr. Camara just have dropped. He would be joining us later. He'll be joining us later. Listeners and viewers, so far, these are the people we have on board. We're expecting the others to join us from their busy schedule, and unfortunately, some of them cannot stay for the length of the program. But we will have the rest to stay with us for about 2 hours. The program should be pushing on to 2.5 hours. And the house rules would be, we have questions prepared and follow-up questions, and we would try to get to all these questions. And as we said, we encourage people to use local languages, or any language they're most comfortable with. And we would give 15 minutes allocated to each participant, and we'll have the 2-minute slot and 1 minute follow-up questions, so that we can get to the end of the program by covering the whole questions that we have already prepared. And I would just ask, if you are not engaged in the dialogue, if you can please just mute your mic so that we can have a better sound, as it's recorded for other channels to connect. As I said earlier, we have simulcast with other radio stations and other platforms, and our video has been shared by other people in order to reach the Gambia, reach on the ground, to impact. I will start the questions. We'll go to both Mr. Marenah, Dr. Marenah, and Honorable Sillah. And Mr. Sane is not here yet. That question was for 3 of them. I would ask the Dr. Marenah, what are the challenges? Realizing that we have leadership vacuum in the COVID-19 task force, the Vice President, Honorable Dr. Samate, the 2 PS, and for health, and few ministers, some top civil servants, and huge number of the frontline workers are either infected or isolated, and the Parliament on vacation for the entire month of August. Who is in charge of the COVID-19 leadership now? Dr. Marenah.
Thank you for the question. I think one of the important things to note from the start is that what COVID has done in general has almost forced us to change the way we do things a lot. Mm-hmm. So being physically present is not necessary anymore for a lot of things that we're doing. Mm-hmm. Those at least taken to technology. So, I mean, the fact that there are some people in quarantine or not in the office, they can still keep in touch and hopefully are doing so by meetings. I don't know, I can't say with any certainty that that's what's happening, but I would like to think that that's what they're still doing. Uh-huh. I know the sort of COVID planning team or task force, I don't know the exact name that they use, they have daily meetings and they do this via Zoom, so they don't always meet, or other online platforms. And that's how they tend to coordinate things. So physically, yes, there may be a vacuum, but I think in terms of keeping in touch and coordinating, I think I'm hoping that is still going on and decisions are still being made by the people entrusted to do so.
Okay, not praying that things would get worse. We pray for and wish things to get better with everybody, especially the frontline workers and the people coordinating this operation. Well, do we have any contingency plans? I mean, that people can step up if in case that they can't be effective in delivering their duties.
I feel that, again, I haven't been involved in any of the committees that have been doing the planning. So when I talk, it's as an outsider and it's what I see from my perspective. It does feel a lot as though there hasn't been a plan, a contingency plan in terms of scaling up. Because what we have in place is fine when we have small numbers and when it's under control. But in the way we see it going, numbers are rising. We've just passed 1,000 cases today. So we need to be at the stage where we're scaling up. But even as we speak, we have backlogs for testing. That to me says that we weren't ready for this to go on a bigger scale. But if it was, then we would have these plans in place. Even if we needed to test 1,000 cases a day, we would have had it there ready for when it came to pass. That's the way we were going. Rather than fine, we can manage 50 tests a day, no problem. But as soon as it becomes 200, 300 tests a day, then we have a backlog of 500, 1,000 samples waiting to be tested.
Thank you. Thank you, Dr. Marenah. Honorable Ousman Sillah, what would it take for Parliament to reconvene and attend to this serious pandemic at this stage of the? We have just had the curfew been announced, and things are getting really out of hand. I mean, what would it take? Mr. Sillah, you are mute. Mr. Sillah, I think Mr. Sillah is mute or his video is freeze. Yeah, I think Mr. Sillah having connectivity problem. He's in the Gambia. He's having connectivity problem. What I would do instead, I will move this thing, and if Mr. Sani comes in, he's back on here. Mr. Sillah.
Hello, yes.
You can hear me now.
I can hear you very well now.
Do you want me to repeat the question, or did you get that question?
Yes, can you repeat the question? I did not hear you at all.
Okay, the question was that due to this, the unfortunate, realities that the Vice President and the Minister of Health and 2 permanent secretaries of health and few other ministers plus senior civil servants and a huge number of frontline workers either infected or isolated, and the Parliament is on vacation for the entire month of August. Who is in charge of the leadership for the COVID operations? And
well, thank you very much. We are talking about governance, and then you have the separation of powers. You have the executive as a domain, and the legislature as a domain. Of course, we do work together. But I would want to agree with Dr. Marenah that with technology, of course, there may be challenges for the meeting physically. But I think with these virtual engagements, virtual meetings, the issue of vacuum in terms of leadership can really be overcome. Because unless you are under treatment, you are being infected and under treatment. Otherwise, and I understand the minister is under quarantine. So nothing stops him from engaging and then giving the political leadership that is required of him at this given stage. Okay, as far as the National Assembly is concerned, as you know, presently we are on vacation, we are on recess, and as such, the committees, oversight committees are not meeting. The plenary also is not in session, but nothing stops Parliament from being prorogued, from being called on an emergency basis, on an extraordinary basis, to consider any exigency
That was my
requires
follow-up question.
parliamentary.
That was my follow-up question.
Yes.
Considering what Dr. Marenah have said, is us we were not well prepared, we were ill prepared, and the situation is literally out of hand, not getting out of hand. And what would it take for Parliament to convene? I mean, what would it take for Parliament to convene?
Well, it can be two ways. Either the National Assembly members may consider the situation grave, that our intervention is required. As you know, the president has declared.
What I think the people will say that we have reached that point. We have reached that point that we want Parliament to reconvene.
I'm not getting.
I mean, what I'm saying is that the people, I think his connectivity is going again. I might have to move the. Question to Miss Saidy because she will be leaving us soon, and because she will be leaving us soon. Miss Saidy, being a survivor, COVID survivor, or the Corona survivor, can you please give us in brief explanation? I mean, what's the duration, the time frame, the infection symptoms, and the recovery, and how did that impact you and your family? How did you manage with the family, work, and community you live in?
Thank you, Ben. I am glad to be here, like I said earlier. So I tested positive I think I did my test on May 19th, and it was during the Ramadan. And it started out, the last few years I've developed sinus symptoms, and every so often in the spring, I will have those symptoms. And so when I had it, I kind of freaked out a little bit because it was also in the middle of a pandemic. And so I reached out to my doctor, and some of the symptoms was a headache that I had, lightheadedness. It wasn't the typical symptoms though. I did not have a fever and I did not have a cough. And so she recommended doing a test, partly because in the middle of our conversation with the doctor, she asked me if I still have my sense of smell. And I always had a sanitizer by me, which I started rubbing on my hands, and I realized I couldn't smell it. And so I mentioned that I couldn't, and she recommended doing a test. And when I tested, it came out positive. So for someone like me, I was lucky. My symptoms did not get any worse. However, I had to do a 10-day quarantine. And within that time, if my symptoms got worse, I would have reached out to my doctor and so forth. As soon as I spoke to my doctor, I isolated myself away from my kids. My husband and I were raising 3 kids, and I isolated myself from the kids, and I did the 10-day quarantine. Now, during that quarantine, it was a little bit hard emotionally because knowing that there's no cure for COVID-19, I prayed every day to God that my symptoms wouldn't get worse because I wouldn't know what else to do. All I would have done was to call 911 and hopefully they can manage my symptoms. But I was grateful that didn't happen. But it took a toll on me because I have a 2-year-old daughter who did not understand why I was isolated. And every time she caught a glimpse of me, she cried constantly. That was a little bit hard on me emotionally, just knowing I couldn't touch my kids, I couldn't get close to them. But at the same time, I was grateful that nobody else got infected in the house. And I also did not have any further symptoms since then. I didn't catch the last part of your question, Ben.
The question is how it's affect your I mean, how did it affect you within the community as well? I mean, your recovery, going back to work, and the sort of help that you wish you had, or this help that you had that other people can benefit from in the Gambia?
So I have been working from home since March 16th, and that's the bizarre part because I didn't go out for the most part. I was doing even my groceries online, being delivered at the house and so forth. So we took all kinds of precautions to be safe, and sure enough, I still tested positive. That said, I was lucky. My mom's here, and while I was in isolation, my husband was able to help with my kids. My mom was also able to help keep the kids going while I was in isolation. And I was also lucky enough, like I said, I'm in human resources. I was able to work from home, so I was not bedridden. Thankfully, I was still able to work while I was in isolation. But I did get a lot of help. When I let some of my friends know, everybody reached out and let me know. But then, because I have very little time, there is something that I wanted to mention. The last few days has been very emotional on me because just seeing so many people dying, and I have to give a disclaimer. I cannot say that all of the people that I'm hearing dying in the Gambia are COVID related. However, due to the timing of it, it's a big possibility that they are dying of COVID-19. I am just begging my fellow Gambians to stay home and follow the instructions of the health professionals. But also I think right about now, it's a good time for us to do away with our culture of silence. I have had a lot of positive feedback and encouragement for me to come up here and even talk about my experiences. But I've also had a few random ones that are like, aren't you concerned? You know, I don't feel stigmatized. I feel very blessed to have had COVID-19 and recovered, while a whole lot of people, as you're aware, in the United States, there's over 155,000 people who have died. I don't feel that I'm any better than any of those people. So I just want to encourage my fellow Gambians. We need to do away with the culture of silence. And just because I don't want to expand this topic, we're talking about COVID-19, but there's a whole lot of issues regarding women and the culture of silence in our country. We need to be a little bit more open. I'm hoping, even if one person listens to me and hears my experience, that they will utilize the instructions and heed it and stay home, that they can save themselves and hopefully save someone else.
Thank you. Thank you very much, Fatou. That's very powerful, and I hope the people on the ground, Gambians on the ground, or Gambians in the diaspora, would take this lesson and pass it on. We are glad to say that we have Mr. Alhassan Senghore on board now, and we'll let him come in and introduce himself, and he will go with the second question. Mr. Senghore, good afternoon. Mr. Senghore, mic is mute. Okay. Good afternoon, Mr. Senghore.
Good afternoon. Good afternoon, Ben. Thanks for having me. Unfortunately, there is a background noise, so I can't hear you well.
Okay. If you can get closer to your mic, you might be able to hear me. Can you hear me now? Can you hear me now? Hello, I can hear you. Can you hear me now?
Yes, I can hear you. It's breaking through. I can hear you, but it's breaking. Yes.
It seems your internet is playing up.
Yes, go ahead.
It seems it's your internet that's playing up. If you can hear me, can you introduce yourself, Mr. Senghore, to the audience?
Yes. Thank you. My name is Alhassan Senghore. I'm the Secretary General of the Gambia Red Cross, and also have worked with the International Federation of Red Cross and the International Committee of the Red Cross for the past 25 years, doing a lot of work in terms of relief and development across the globe, mainly in Africa, Europe, and the USA.
Thank you. Thank you, Mr. Senghore. Thank you for taking your time from your busy schedule to come and raise this important discourse. I have a question that I want to put to you and Mr. You and Dr. Marenah. And the question would be, provide a summary of the numbers of confirmed COVID-19 cases, the number of recovery, the number of death, the number of patients currently in ICU, and the number of patients currently hospitalized. Can you help us with that data, please? I think, Mr. Senghore, did you have another device on?
Hello?
Did you have another device on?
Hello? Yes?
Did you hear that question?
Hello?
Did you hear that question?
Yeah, it's breaking. I can't hear. No.
Okay. Okay, what I'll do is I'll go to Dr. Marenah and we'll try and get your line sorted out. Dr. Marenah. Yeah,
Yes.
can you help us with the questions while Mr. Senghore has been line has been fixed, providing a summary of the number of confirmed COVID-19 cases, the number of recovery, the number of death, the number of patients currently in ICU, and the number of patients currently hospitalized.
So essentially, from the last the update from today, which we have to remember is Wednesday statistics, which they released today. So from Wednesday, it was a total of 1,090 confirmed cases in total, 925 active cases. And that means 146 have recovered, and there's 19 deaths. And if you look at the statistics, they don't always add up because there was, I think there's still 2 unaccounted for and 4 who had left the country. So, I mean, what is a bit more difficult to say is, so of those 925 cases, the majority of them would go to the treatment, would be under the sort of treatment arm. What they tend to do is the asymptomatic ones are taken to a hotel where there's a nurse and doctor who will check on them. And then those that need active treatment or the more sick ones are kept at the sanatorium, the treatment center. When you look at the numbers, I think, I don't recall off the top of my head exactly how many beds are at the treatment center at the sanatorium, but I would hazard that it's not over 50. Okay. So if we have 925 active cases, then that would mean that a number of them either are being managed in hospitals to some extent, if they're unwell, or they are all in the sort of well group where they're being kept in hotels and being monitored. And there's of course now some that are still at home. There's been a recent change of tactic where I think positive cases who 10 days since they were symptomatic are being allowed to go home to continue self-isolating at home without having a second test. Because of course we're struggling with space, and I think that's the way for them to try and free up a little bit of space. The ICU is a bit more difficult. I mean, the sanatorium has been refurbished and it's got some beds with monitors and with oxygen for ICU care. But of course, the only full ICU, if I can call it that, is at EFTHS, and that only has 8 beds. So we probably have about 20 beds in total with ICU type capability. And even, I wouldn't say all of those even definitely had ventilators if patients needed them. It seems unfortunate from what we're hearing in terms of the people that are getting very sick. A lot of the patients that we're getting are coming to hospital a little late, it seems. Either whether that's delay in referral or whether that's them not presenting because they're waiting at home and scared to come to hospital until things are late. But you do hear a lot that die very shortly after arrival in the hospital.
Yeah.
So we haven't really got to the stage where we're getting people who are in ICU beds, unwell, and being treated, because it's almost binary at the moment. You're either very well and being managed, or you're so sick that as you arrive to the hospital, you pass away even before, some of them even before they get tested for COVID. And the COVID test is done posthumously. And that seems to be the situation at the moment, which is unfortunate.
Thank you. Thank you for this thing. Ms. Jagne, thank you for waiting. And we having challenges from the line from Banjul. I can see that, Mr. Senghore is still struggling to get back on. Ms. Jagne, the ideal to improve the the ideas to improve the contact tracing protocols, call centers, test places, temporal ICU, and treatment centers in the country, advanced to decentralized treatment and testing centers. I mean, what ideas do we have to improve? What ideas do you think that needed to improve these services from the contract tracing protocols, from the call centers, the testing places, the temporal ICU and treatment centers in the country, not only within the combo, but decentralized to the province?
Okay, assalamu alaikum, everyone. My name is Fatou Jagne. I don't think I got a chance to introduce myself, so let me just say that I do not reside in the Gambia. I reside in Atlanta, Georgia. I am a public health specialist, an environmental health specialist. I studied public health and have worked in public health for about 6 years. So I am just giving you my perspective from from living in America and having Gambian parents and visiting Gambia. I think with contact tracing, having the capacity to do so is very important. So first of all, establishing capacity in environments that are usually not, that you wouldn't use for contact tracing. So if it's just getting creative and setting up home offices, then you can do that. You don't necessarily have to go into an office. I think, someone mentioned in the beginning that we just try to stay away from each other as much. So don't think that you have to have an office space to do contact tracing. You can do contact tracing from your home. So that limits the spread of possible infecting others, because we know that a lot of people are asymptomatic. They don't have any symptoms, but yet they're still spreading it. The people who are higher risk are the ones that suffer. So I think just having, just thinking of innovative ways to do contact tracing. I know with ICU centers and testing, all of that just has to deal with the capacity. I don't know. I'm on the outside looking in, so I don't know what the capacity is in Gambia for testing, but I know that if you're doing it, then the people that are testing should be trained on properly doing it in a way that doesn't infect someone else, because the testers might be asymptomatic. They might even have it and not know they're carrying it. So I think just proper training and using maybe some funds that were allotted for this coronavirus, just maybe using that to set up, like I say, innovative ways to test, innovative ways to contact trace, and also training. I think, not just giving someone a testing kit and saying, go out and test. Like, they should be trained staff. And I know that the hospitals and the doctors, the nurses are so overwhelmed. So you might be like delegating to other people to test. But I think that training is so important, because you can be doing more harm than good if you don't know how to properly test, and you might have a lot of inconclusive results. And then that's another thing where the tests come back and it's not clear. So now you've wasted a test, if that makes sense. So I think.
Thank you. And in the area of, creating capacity for the ICU, as we have heard from Dr. Marenah, we don't think that we have enough. And what solutions do we have? Can we have to create, the capacity, to increase the capacity?
I personally think that looking outside of the hospital spaces and maybe some open areas and setting up beds and hospital type, it's not, it's not ideal, but I know that there have been some cases here, even in the United States, where we've turned convention centers into ICU, like literally into hospital beds and beds where like are treatment centers basically. So that happened in Georgia, it happened in New York. So it can definitely happen in Gambia. It might not be ideal. You know, you're saying that you're getting tested like at a stadium or a convention center, or you're getting treated there. But if the facilities are in place, if you have like your makeshift hand washing stations, if you have everything that you would have in a hospital there out in the open, then that can be used. And it's just an innovative way of addressing the problem and addressing the capacity issue. So I think just trying to look for open spaces where you can separate the beds out and have physical distancing would be ideal.
Thank you. Thank you. Dr. Ceesay, Dr. Fatou Ceesay? And I think Dr. Ceesay is dropped.
Yes.
Okay. Dr. Fatou?
No, I'm here. Can you hear me?
Okay. Okay.
Yes, I'm here.
Yeah. And
it keeps dropping. I think I need to go sit on my box and make sure it doesn't drop off.
Yeah. Did you hear the question I asked earlier to Ms. Jagne? The idea of improving the solutions that we can try to find in order to remedy the lack of capacity on the ground right now, as we heard from Dr. Marenah. And again, it seems as we are concentrating on the urban areas. What ideas can we have for decentralization in case we need to have intervention in the rural communities? I think Dr. Fatou is struggling with her line too. Can I come back to Dr. Marenah?
Yes. I mean, I think we need to. I don't know what the strategies are, but I would hope that what was decided was that maybe every region, given that we have 5 regions, has a center that's designated for treatment and also for testing, because there's no once we get to the stage where this is pervasive, which is almost is now, having to take a sample from Basse all the way to Banjul to have it tested to get someone's result, I don't think is the way to go. So we really need to be in a situation, or have a situation, where in each of the 5 regions, or at least where the 5 major hospitals are, get a treatment center close by that can be staffed. But of course, the other issue is we can create spaces, we can create beds, as in we can have them, we can get equipment, but one thing we can't manufacture is people and staff, human workforce. And we already run with a limited number of nurses and limited number of doctors. So the other issue that comes in is, if you start expanding like that, where do you get the nurses and doctors that are going to staff these places? And that is going to become a problem, because either you take them from the existing hospitals, which then means everything else suffers, or we have to be innovative and find another solution. And it's not going to be a simple solution, I think. The other thing I wanted to mention regarding the contact tracing, I think at the moment, maybe Dr. Jagne could correct me, but if you look at the last 3 reports, we have been getting consistently 40 to 43% of all tests coming back as positive. If that really means that 40% of everybody who's testing in the country is positive, then I think you almost at that stage of a epidemic, when you're talking about locally, the contact tracing is important, but then becomes less important. It's more about the testing, knowing people, finding out who is positive and getting them to isolate, because it's about then breaking the chain of transmission, because we're already in established community transmission, and the contact tracing may not, for me at that stage, may not be as important as getting tests and knowing people's statuses. And that seems to be the big bottleneck at the moment, and I don't know how we get around that. The other thing is that, again, the crude mortality rate that we're seeing is 1.9%. There's 19 deaths, and I think people deaths are never reassuring, but when you look at it 2019, it doesn't seem so bad. But when you think of it as 1.9%, again, it still looks small. But if you think about the way it's spreading, 40% of tests are positive. We assume that 40% of the population is going to catch it. That's about 1 million people. 1.9% of 1 million people is 19,000 people. There's a potential for 19,000 deaths. And I think that's how people need to look at that. That's a very, very big number for Gambia. So, you know, we really need to start coming up with the plan B or the plan C. Plan A worked. Plan A has to go out the window. Plan A is no longer working. It's no longer fit for purpose. And I think we need to boldly come up. If we didn't have a plan B, now is the time to devise plan B and see how we can do damage control really with what we have. It's trying to make sure we don't get those 19,000 deaths. Because in our tiny country, 19,000 deaths is going to touch everybody.
Thank you. Thank you, Mr. Marenah. And we seem to have Honorable Sillah back on. Mr. Sillah, can you hear us? Mr. Sillah, you are mute, Honorable.
Okay. Am I?
Okay.
No, I'm not.
Yeah, you can hear me now.
Okay, I can hear you.
Yeah.
Yes.
I'm sorry for the disruption. The situation we have now in the country, we just had about the challenges they're having with the COVID situation, and now the solutions are being provided from here, but what is the coordination from the ground? I mean, is the coordinators really effective? Can Parliament really convene to find out whether things are really what they supposed to be, or what they said to be?
Well, going by what is being said, particularly Dr. Marenah, things look very scary. Gambia cannot afford 19,000 deaths. Everybody is going to be affected. And that something ought to be done. And it is now that we should really gather our act. I think this is food for thought for everybody, particularly the decision makers at both the level of the National Assembly and the Executive. As I indicated earlier, nothing stops Parliament from reconvening, from calling an extraordinary session, even if it is going to be 2 days, to hear from the health experts as to what should be done, and then support be given in terms of legislation, in terms of resources, in terms of supporting the policies. We are not policymakers.
Thank you.
We can support the policies. We are lawmakers.
Thank you.
And then as a National Assembly, we have oversight bodies. There is one on health, there is one on trade. But as I have been emphasizing, COVID is science, COVID is health. We must allow health to take the lead. Of course, this doesn't mean that COVID does not have other implications. There are other ramifications, like particularly on livelihoods. There are committees at the level of the National Assembly that can also look into that. But the emphasis really should be on how to contain the surge, to ensure that we are not going to end up having even 5,000 deaths. That's unacceptable. I think this is as a National Assembly member. I will, like I said, there are two approaches. The National Assembly can consider it grave, consider the situation grave, requiring reconvening to consider the exigency, or the President can also ask Parliament to convene an emergency, or what we call it, extraordinary session, to consider the situation. But I think it would not be far-fetched for Parliament to reconvene to consider the situation.
Thank you. Thank you, Honorable. Thank you, Honorable, for that answer. We hope that things will not get bad, but you guys would be on the ball, and as soon as possible to take the mechanisms that are necessary in order to remedy problems. And unfortunately, again, we still have the most of the panelists are struggling to get in, especially those in the Gambia, and but we still have Dr. Lamin. Can you minimize? Just see the. Let me get the panelists on. Thank you. Yes, we still have. Miss Jagne and Dr. Kebba, Marenah, and Fatou Kassama. Fatou Kassama. Kassama Saidy. I know you're about to leave in 5 minutes. Can you just come on and give us your last, words, and then we can really appreciate you. We really appreciate you taking your time to come onto this program.
Thank you again, Dan. So before I go, and I just put this in the comment, and Dr. Marenah commented a little bit, but I wanted to ask, there were claims on What's on Gambia, I think about 2 days ago, or maybe yesterday, I can't quite remember, that people were being turned away from Serekunda Hospital, Brikama Hospital, and as a result, 2 people died. I don't want to name names because I don't have permission to mention them. But are those claims true? And if so, where should the people go? People in Brikama, for instance, if they're experiencing symptoms, where is the nearest place to go? Because I'm just imagining if somebody's sick in Brikama and they have to use public transport rather, to go to Banjul, I can only imagine how many people along the way, getting in multiple, buses, vans, whatever it takes to get to Banjul, and how many people they come into contact with. What are the ways they are helping people down there?
Okay, Mr. Marenah, can you answer that question, please? I have seen that you have text the answers, but can you help us with answer, please?
I saw the claims on What's on Gambia as well, and I don't want to say that they're false without having the details, and I don't know. There are difficulties. Of course, when we talk about health care workers, we're talking about humans, and not everybody behaves the same way in every situation. There may be a case where a health worker is not when a person is symptomatic or suspected as COVID, that maybe the particular health worker on that day is reluctant to deal with them. I don't know whether that's the case of what happened, and then maybe the family then decided to take them away. I don't think, from experience, that anybody would be denied care at any center. But again, I cannot speak for what happened on those days and why those patients ended up the way they did. I know one of them ended up coming to EFTHS, but I believe passed on the way to EFTHS. There are as the different sort of complexities around it. But I think what we should be encouraging people to do is present early. I get calls from people saying, I wonder, I have these symptoms, I think it might be COVID, maybe could you come and see me, could you come and assess me? And really the answer is, with COVID, the sooner you start treatment, the better. So we shouldn't do the usual Gambian thing where we sit at home until things are very bad, until you're breathless and struggling, and then you go to the hospital. I'm not saying that's what's happening in all cases, but I think I would really just like to encourage people, if you have family back home or if you're in Gambia, if the first sign you suspect that it may be COVID, go to the hospital. People are worried maybe that they could catch it there. It's not, I don't think that's the case. And again, as we look at the figures, 40%, it's possible that 40% of people in the country have it, or at least the ones who are being tested. So it's all around, and the hospital is probably not any more of a hotspot than anywhere else, or even your local community. So I would really encourage people to try and go to hospitals as early as possible, get the test done, and also maybe start getting treatment for whatever it is. It may not even be COVID, but it's still maybe something that could save your life. If you're feeling ill, go to the hospital early.
Can I put the follow-up question here then? Which hospitals and clinics in the Gambia can conduct the test right now, and what's their capacity?
So, the way the tests are going on, there's only 2 facilities, as far as I'm aware, that can run the tests, which is the National Public Health Labs in Kotu and MRC in Fajara. I believe MRC are trying to expand to some of their other stations where they have the machine that can do it, but government has National Public Health Labs, and that's it. So that's where the tests can be run. But where you can take tests, it just depends whether there's trained personnel as Jagne was saying, we need people who are trained to be able to take the test. And I know for EFTHS we have people who are. I believe Canifing probably has the same thing. And if they don't, I think that's something that really should be stepped up, where every single center has someone who can at least take a sample from you. I think maybe some of the private hospitals are even starting to do that. But I think that's something that's very important to get started early. We need to get people tested. But again, I mean, the way our health system is set up, it's I work at EFTHS and we're what we call a tertiary center. A lot of cases get referred to us. Similarly, Canifing have the same. And there is a general tendency where if someone comes unwell to any other center, because of the staff that's available and the equipment that's available, they will end up referring you to one of Canifing or EFTHS in Banjul. And that's a normal pathway, even before COVID or even outside of COVID. If it's difficult or complicated, you will be referred to a bigger center. So that's why a lot of them would end up coming to EFTHS. And unfortunately, some don't make it even on the way. I mean, we saw the recent arrival of ambulances, and I hope that those are in use and in circulation, because at least then people will have oxygen and things and have treatment on the way. But that hasn't been the case in the past, unfortunately. We have to be frank and talk about the situation as it is. A lot of people die on the way to the hospital, and that's even from one hospital to the other, because we didn't have proper ambulances with oxygen, with paramedics on board, and so on and so forth.
Thank you. Thank you, Doctor. We'll come back to that. It's scary that you cannot confirm that whether the ambulances are in use or not. We thought they would be in use by now. Ms. Jagne, the problem associated with taboo, with this COVID in our society, the Gambian myth, if any. Can you give us advice? Can you give, probably if you are comfortable in any other language, but if not, you can do it in English for our local viewers.
Okay. Sure. So I think that
okay.
I'll just continue to speak English. I guess yeah. So I know that some of the myths that I've heard. The first one was that it was a man-made disease, that it was created in a lab. And I just want to bust that myth and say that that's not the case. Coronaviruses have been around since the early 20th century. When you look at like global pandemics like SARS, MERS, which is the Middle Eastern Respiratory Syndrome, even the common cold, they're all coronaviruses. COVID-19 is just another strand in that same family of coronaviruses. So don't think that it's a man-made disease that is can be controlled by man. Like, that's not true at all. And I also heard that you will know if you have coronavirus, like you'll know. And that's just simply not the case. If it's in an older adult or someone that has an underlying health condition, then you may know, or you probably likely will know. But if you are a young, healthy adult, you might not have any symptoms at all. And I think that's the scariest part for me when I think about Gambians. And I think about the youth in Gambia that just go from house to house and they're just so free. Now is not the time to do that, because you can definitely have it, not show any symptoms at all, and spread it to your older loved ones. So that's another myth that I've been hearing. And I've also heard that, there are juices or natural juices that you can take to cure coronavirus. That is simply not the case. It won't cure coronavirus. There are definitely things that you can do to boost your immune system to make yourself, stronger to fight it. So you don't get to that point where you're needing to go to the hospital. Maybe you can just self-quarantine and treat yourself. We know the immune boosters. We know maybe garlic or ginger, but that's just for your own health. That's just to boost your immune. That's not necessarily a cure for COVID. So those are the three main myths that I've heard that I just wanted to say that that's not necessarily true. So don't just lie on that and say, oh, it's going to be okay. Like Yalla Bahna, that's not, we need to be a little more serious than that. So I think as far as like myths, that will be it. And as far as taboo, I think Miss Saidy did a great job of saying that, it needs to be destigmatized. Like, you should not stigmatize the virus. You should not be afraid to say if you have the virus. It can help someone. Even if you're not showing any symptoms and you say, oh, I have it, but it's no big deal, I can go on about my day. I don't think that's the right mindset to have. I think you should stay isolated as much as possible, if not for you, then for your loved one, because I think we all know someone in Gambia that has an underlying health condition. Like there's so many cases of diabetes, so many cases of hypertension or high blood pressure. So I mean, I think that destigmatizing it, talking about it openly, if you have it, if you have experiences of it and not trying to hide it, is very, very important. So I hope that answered your question.
Thank you. We'll try and, okay, Dr. Fatou Ceesay is back on. Dr. Fatou, can you hear me now?
Yes. Yes, I can hear you.
Okay. I'm sorry for the, I mean, we wanted to, have you on earlier, but we could not get you due to the poor lines. What symptoms should cause one to call the 1025 or the health center for help?
So
what are the symptoms?
I mean, the symptoms to watch out for that would prompt urgent call for help would be things like having difficulty breathing, obviously. If you are struggling to breathe, the symptoms we look out for COVID are the fever, cough, shortness of breath. There is obviously what my sister Fatou talked about, if you're having symptoms of loss of smell or taste. But the big things are, of course, when you're having difficulty breathing, shortness of breath. So that is a risk. If you're having a lot of trouble with that, you obviously need to go get some help. Obviously, it sounds like there's a problem with securing an ambulance, so that is sort of a care monologue noki.
Wow.
You need to go to the hospital where perhaps oxygen could be administered to you. Nila dimbala nga noki, then nga dem ote am ko la dimbale o sa mbokk yi dem la yóbbu lopitaan nga am ko la dimbale ndax nga mën a noki. Noki bi SARS COVID-19 COVID-19 infection affects your lungs, obviously the ability to breathe. So if we so noki wote amulona. So the biggest thing is to definitely make it to the hospital so that you could breathe. It affects your lungs, affects the noki way la te su fekkee ne amuloo noke amuloo dara. So definitely the biggest thing here is your respiratory system. And if you're being affected and you are unable to breathe, obviously you need to
And Dr. Fatou, ju jekkali foofu rek su nekkee ne borom yëg na yaramam loo wax fii yëpp ne yëg na lu mel noonu yëpp si yaramam lan la war a def si kër gi war na moo commencé pour nekkal boppam lu ñoo ooyee isolation mu jàppee boppam mel ni ku ko am ndax lu waxtaan boobu lañ bëggoon a xam lan la nit ki war a def tam si mbir moomu.
Well, des na rek si naka la ñëwee su fekkee ne it's already symptoms, it's better off you go seek medical help and you test la, make sure ne lan nga amee, because it's important to know what you have. That will prompt the obviously contact tracing. You know what you said, Kenan, so positive for COVID-19. You said ninga dekal ndax dang len ko wala. So obviously, so you said, who else have you come into contact with, so that you isolate? Because the big thing with COVID-19 is it needs a host. It needs so we need to figure out can come into contact with, so that we can break the transmission, so that we can reduce the infection rate. So the symptoms is important that you go get tested, so that if you become positive, you figure out can ko wala. So you or anybody else you've exposed you muna isolate them boba buñ ko wala kere. because that's the only way we're going to stop the infection or the infection rate from going up.
Thank you. Jërëjëf Dr. Fatou Ceesay, jërëjëf. Mr. Marenah, what are the protocols and process for handling the disease of COVID victims from home, hospital to the graveyard? Dr. Marenah?
Yeah, sorry. So, I mean, at the moment, the way the system is devised is that you present to a hospital, firstly, or there's some people who are actually getting tested now. People are getting more aware where they're going for tests. You know, at Nemman Health Center, often the team is there, and you can go there to get your test done. Those ones, if they test positive, the majority of them are usually either asymptomatic or mildly symptomatic. And then they'll get a call and they'll get picked up and they'll be taken to the hotel where they're isolated, or they self-isolate at home. The other ones are the ones who come to hospitals. So usually when you come to the hospital, you get seen, and if you're thought that you are a suspect for COVID-19, then you go into an isolation area, assuming that there's space, because again, most of the hospitals don't have that much space. You then get tested, so we have to call the team to come and test you, and then you are treated for whatever symptoms you have at the time, so until such time that your test comes back. When the test comes back positive, then you get moved to the treatment center, sanatorium. But again, the delay in testing sometimes means it takes 2 or 3 days to get the result back, during which time we have to treat you in the hospital. So in Carnifing, I'm sure at the time that currently, they have a lot of patients in so-called isolation that are really being treated for COVID. Because by the time the result comes back, they've already had to start some sort of treatment for them. You can't just wait for the result. And the rest who get a result get sent to the sanatorium, which is the treatment center, and then they're managed there. People get repeat tests, so that once your tests come back positive twice, then you get released. But you're kept there until such time that you recover, which is when your test comes back positive. Those are for the sick ones. And that's what tends to happen. As I said, I stand to be corrected because I don't know exact figures. I think
the question is about when in recent today there are a lot of incidents yesterday or day before yesterday when people are announced dead at the home, and because of the suspect of COVID. How do we approach that situation when we find our loved ones or our loved ones struggle with any other ailments and happen to be dead in this situation? How do we handle that to the point of burial?
So the way the system is, you always have to get a death certificate, which is same thing in most countries. So they end up having to come to the hospital, and then once they come, somebody will ask, what symptoms did they have prior to passing? And I think we need to have some public awareness around this, and a lot of people are maybe complaining or concerned about the fact that now a lot of people who pass away are being tested. For me, that is the right way to go, because we need to know how many people are being affected to the point that they're turning out to be mortalities. But unless people are sensitized to know why this is happening, it makes it very difficult. People are very resistant. We're a Muslim country and people want to bury quickly. So what happens is that if you're brought to the hospital, then the process happens where they have to take a sample, and then you need to know whether they're positive or negative. Because if you are positive, then what the system that we have in place is that the Red Cross are the ones that do the burial. I'm sure you've seen the pictures of them wearing the full PPEs, the gowns, and they conduct the burial with as few people there as possible. And that's the way that we're going about it now. Again, we have to start thinking about scalability and scaling up, because that's fine if you're having 1-2 deaths a day. I hope we don't get to the situation where we're having 20, 30, 40 deaths a day. But that, of course, we won't be able to cope with that, having the Red Cross to bury all those people. So I think we have to start it's now that we need to come up with the plans, not wait till it happens and then sit down and think, what do we do now with this situation? Let's plan ahead. We plan for the worst and hope for the best. That's the way to go about things. You have the plans there. It's better to have them or not use them than to not have plans.
Thank you, Doctor. Thank you, Doctor. I have Mr. Alhassan Senghore on the phone right now. Hello, Mr. Senghore.
Yes, Ben, good evening.
Good evening. Sorry for the bad line, and I want to give you the opportunity to quickly introduce yourself, and we will get on to the questions. And you are encouraged to use any language, preferably one of our local languages.
Thank you. My name is Alhassan Senghore. I'm the Secretary General of the Gambia Red Cross Society, but I have been working outside with the International Federation of Red Cross and the International Committee of Red Cross. And my last two positions were Regional Director for Africa for the IFRC and also Permanent Observer to the UN in New York. So I've had over 25 years of experience working in relief and development across the continent and also in Europe. Thank you.
Thank you. Mr. Senghore, we first start with one of the questions, and I want to put two questions to give you time to cover the laps we have. And the first question is, the Red Cross have been doing a lot processing the dead and taking care of our dead ones from homes and every other place they find them. We want you to advise us, what should we do if it happens in the house in this period of COVID, and especially when the person have manifested symptoms? How do we handle the situation up to the time of to the graveyard?
Yeah, thank you. Before I get to the burial, I think I would like to emphasize that the overall vision of the Red Cross is saving lives and changing minds, especially within the context of COVID. Saving lives, that is meaning doing as much protection and prevention as possible to save lives and also protecting people's lives and not burying people. This is not what we wished for. Unfortunately, as it happens now, to cut the chain of transmission, one needs to do safe burial, that is safe disposal of the body. And this is what exactly we do. And I think Dr. Marenah, I was listening in, but I could not see or speak. But I think Dr. Marenah highlighted, what we do. What we do, we call it safe and dignified burial, meaning creating a safe environment to cut the transmission, because if someone dies from COVID and is tested and is positive, or if somebody tested positive for COVID, that means that the virus is still alive in the body. So therefore, what is done is basically to clean the body and to wrap it and to give it a dignified burial so that it doesn't contaminate the family members or others who normally do the rituals. So what we do basically is a whole process of decontaminating, but also doing all the processes. If it is a Muslim, the way it is done. If it is a Christian or other faiths, that's it's done properly. We have teams that have been trained in the different faiths, and they know how to do it, both from a medical point of view, but also from a religious point of view. And sometimes, if it is possible, we invite the family members to be with guidance and protection, so that if they wish to be part of the washing and so on, we do it with them by giving them full protection. With regards to the process, how it goes is that actually most of the deaths happen, if it happens at home, it has to be taken to either the mortuary or somewhere in the hospital. And then the health workers will have to take a swab to do the test. Now, people have been talking about a backlog and the mortuaries have been full. This was basically, as Dr. Marenah said, is systematic, and this is one of the protocols that because we have COVID, most of the deaths, they're advisable to test them, to take a swab, to test them before, so that you can go back to the contact tracing. If the person tested positive, then you go back and trace the contacts and then start isolation and treatment. And that's the only way we can cut the chain of transmission. So that is why it is very important that when somebody dies, either at home or at the hospital, this swab is taken and is tested so that it is confirmed. Now, to handle the backlog, what the ministry has done was to say, okay, now once we take the swab, we go into discussions with the family, because the safe and dignified burial is also something you do. First is the engagement, which is community engagement and accountability, where our volunteers don't just go and pick up the body and start washing and disposing, but they engage the family members, counseling them, talking to them on the process and what it means and why they're doing it and so on. So it takes a lot more time and energy than people may think.
Thank you.
Because that's why we call it safe and dignified burial. So once that is done, if the family agrees, the swab is taken, and the results are not yet out because of the backlog, and the family wants the burial to be done, then the burial is done. But at the same time, once the results comes out and it's positive, then the health workers can then go back to the family and do contact tracing and then start moving into the next level. So that's how it happens. So with regards to your question as to what happens in the community, I think
what advice would you give to the family to deal with the situation in hand, the body? And again, the advice, we'll be happy to hear advice for what the family should do in to avoid, further down the line, the Jale, Jale Yunjedef at all those traditions at you.
Sure. No, actually, what is advisable with this COVID now, if somebody dies at home, the best thing you do is basically to avoid direct contact with the body. You can use gloves, face masks, face shields, and so on and so forth. And then avoid contact as much as possible and try to call either the 1025 or call. I mean, we are trying to get a number at the Red Cross where they can call, because this past few days our teams have been busy picking a few bodies from houses or mortuaries across the Greater Banjul area. So they can call, and then our teams will go and pick up the body and take it to the mortuary so that the swab will be taken, or the health workers will come and take a swab. So I think the first advice is really that if somebody dies, is to avoid too much interaction. And whatever is done, it has to be done in a hygienic way, either using gloves and masks and face shields or whatever, to avoid that. And then call the health or transport. If you can safely move the body safely to the nearest. But again, people should understand that they should not, and this is what has been happening. Somebody dies, before it is known, they just quickly wash and bury the person. And we have seen that happen. And then after a while, you see family members getting sick. So this is really very dangerous. So I think my advice is really that if somebody dies, there is no shame about it. COVID is everywhere. We've seen high-profile people. I mean, doesn't know politicians or leaders or whatever. Anybody can get COVID. So if there is somebody who dies, it's not a shame. Just report so that people are protected. The rest of the family are isolated and treated, and then we can cut the chain of transmission.
Thank you. Thank you, Mr. Senghore. This second question would be, what other options would be available in the case that the patient has been tested positive, but the treatment centers become full or in full capacity?
Well, I think the point is really that I heard at the beginning what Dr. Marenah said, and I concur and I support. I mean, we came into the planning process towards the tail end, I think under normal circumstances, when you plan for emergencies, including epidemics like this, you do scenario planning. Scenario one, when you have little cases, and then scenario two, you have some cases that you can handle, and worst case scenario when you have a situation where we are heading to now. And you plan according to those scenarios, and then you build your resources and needs around those different scenarios. So by now, what we should have been seeing, if the planning was properly done, we should have been scaling up both in terms of our personnel, our equipment, and our bed facilities, hospital facilities, or treatment centers, and all these other things. Notwithstanding, I don't think we have to cry over this thing. It's done, it's done. Where we are at this point in time is really to scale up in terms of increasing the treatment, the bed capacity in terms of treatment center. So I think the people at the treatment center, they're doing a bit more in terms of trying to look for alternatives. I know in other countries, what you do basically is to look at options that are available there. I mean, I have tweeted a couple of, almost a week ago, that by now, what we should have been doing is basically looking at options. If we have to bring in field hospitals, ask our partners to bring in field hospitals that can be set up within 24, 48 hours. If we have to ask our partners to bring in more experts to help and more equipment. I mean, those are all possibilities, but they have to be requested, and they have to be requested by the government.
Thank you.
So therefore, this is exactly what we should be doing now, and not to wait until it's last minute, then we start running around. So I think this is inevitable, and we have to do that. So for me, frankly speaking, if you ask me the answer, and I think Dr. Marenah alluded to it, is at this point in time where we have community transmission, the best bet is to increase our action in terms of cutting the chain of transmission, or stopping the transmission. How are we going to do it? Intensify our risk communication with communities, or community engagement, because what we have done in the past was that we were able to do risk communication. Every Gambian can tell you what to do to prevent or to avoid. Cover your nose, do this and do that. But we should have moved away from that long time ago by really moving to the next level of getting the people to engage, communities to engage, families and religious leaders and so on. They all accepted that there was COVID, some, but they did not engage because everybody has a role. So what we are doing as Red Cross, we are not only doing burial, but we are, in these days, we are going to intensify more community engagement in Banjul, in the greater Banjul, in the whole country. So from tomorrow, we will be relaunching all this, intensifying our campaign, awareness campaign. And the messaging will be different in the sense that we have reached a point where we are at community transmission. And when you are at community transmission, the messaging should focus on the question that you are asking. If somebody is sick, what do you do? How do you help before the person gets to a doctor, and so on and so forth, or get to a treatment center? And also some of the few things that you can do to save life before you get to professional help. So this is where we are now.
Thank you, Mr. Senghore. If you don't mind to hold there, and I'll just move the question to the other panelists, and you can stay on the line, or you can come off the line and listen to the other side, because I'm using the same phone to contact the coordinators. But I'll call you soon for the follow-up questions. Thank you very much, sir. Jerejef. Thank you. Thank you, guys. This question will go to all the, I have my colleague, Babu Abla Diop, the diaspora. He will be taking on from this question. But, Jagne, why is it important to ask Gambians to stay home during a pandemic and this magnitude and of scope? Why is it important for Gambians to stay home when they can and take social distancing and wear masks very seriously? Citizen responsibility to each other as family, neighbors, and friends. Why is this message important?
Yes, so thank you again. I think that it's very important for people to take the public health messaging very seriously and to actually social distance and wear their masks, because we need to go back to how the virus spreads. The virus spreads by people who are in close contact with other people through respiratory droplets. So if you are not in close contact with another person, then there's no way, like I know someone before mentioned that the virus needs a host to thrive off and to live on. If there is no host, then it won't live. So if you are not close to other people, you can't, you can't share that or you can't spread it through your respiratory droplets. So that's why it's important to social distance when possible. It's important to wear your mask when you're out in public so that you are not giving off those respiratory droplets, and you can avoid catching it from someone else. So I think that's really important. And it's also important to understand that everyone is at risk of getting coronavirus. It's not just the elderly or babies or people with underlying health conditions. Everybody is at risk. So I think that knowing that will kind of encourage people to social distance and to take those precautions seriously, and knowing that it will look different in everybody. It'll probably be more dangerous in the older adults, but it can still affect you. So, we heard earlier from Ms. Saidy that it affected her. Even if it didn't affect her as seriously and as gravely, it still affected her emotionally. She was away from her 2-year-old daughter for 10 days, so instead of going through all of that, you can just avoid it by social distancing, wearing your mask when possible, washing your hands, and avoiding touching your face.
Thank you very much. Thank you. Kebba, Dr. Marenah, if I'm going to follow up Nabani only, I mean, why is it important? During this period with this pandemic, munatina na mol nyante sila suokono ni ketako imang haju sort of banta o na ketako ilafta fintila banta nyanta minekela pour munatina ning this information important.
So kam yafo nyameng nin kurango aka sound molela aka bo mo kidinto kata mo doto so nim mo ya soto nani mo kote mambeng ani mo man diamo then ate sound na kata mo doto so nyanta wala mirala kufula lebije killing ni de sida sokono imman finti imman dun mol kono then nitema soto eta soto nola because ini molte beneme ya soto puri fongo ya soto. The second thing, ni be si in so kono fana ya je ko e quand même for symptoms nyol for be toto man si aje baake o e baloka kandi e wol sifa den itanyenta menkela wolem ayda yeta l'hôpital auto pour ye test o ni be so kono e be sile fanyi because nite ya soto asike atete fango batandila so ko ni mu funding kewol atete batandila baake as possible atete batandila baake bari mol men bela sokono ke bal men bije men ye sukur kurang soto men ye selo soto men ya asma soto abe wol ni wol nata soto abe wol batandila baake kam mel moy ni wating mol men fata jama mu ke balet so funding kewol bije men ba soto kan e beta kan dulato e mantara sikan sokono ni be sokono ni molle be siring ni molle kakacha so e ba sound kan nyin dolto and ni mel ba soto abe wolle batandika so mol nyanta wala jubela nyanta sila sokono e saje si fantanka pour ka soto because definitely la mol kan so ite da soto la ni tema soto membe la sokono fanta soto la bayne ya soto fang ni be sin sokono fang fenol bije finance men keno pour wol fana na soto ade kana findi banda ya sound mo dole fana.
Thank you very much, Dr. Marenah. And I would be passing on to my colleague, Baba Blajob. Babu. Babu.
Can you hear me, Ben?
Yeah, we can hear you now.
Oh, thank you. Sorry, Balalmar.
Babu, whilst you're doing that, I'm going to call, Dr. I'm going to call Alhassan Senghore, Mr. Alhassan Senghore, to be on the call. Mr. Senghore, just hold the line there. We're going to put you through soon. My colleague is taking over from me now. Just stay on the line.
No, Ben.
Yeah,
you're doing a wonderful job. Please, moderator. Just wanted to.
Okay, come. Yeah, you can come with your. Do you have a question?
Well, I wanted to thank panelists. Great job that they're doing. People are listening, connected to the radio on my end fee. I'm sure on yours too as well, and social media. I want to react to Dr. Marenah's projections, which is 19,000 people, which is something I fully buy. The potentials of loss of life. I joined panel B as an activist. Lolo is unacceptable. Because we have educated people, we have a government, we have laws that should prevent that. For the past 1 hour, 30 minutes of Watan Bini, we are seeing the heroism of the frontline workers. We are seeing people doing everything they can, both to social media, see radioing, as far as sensitizing the people. What we have in our country is a traditional problem and cultural problem of understanding things like this, because there's always a clash in our culture, the religion, and science. So part of the strategy, should be well spent on as far as time is concerned and sensitization mining. We have to target household leaders, seeing communities, seeing Jumai, seeing Choji, because the Gambian people are more likely to listen to a head of a household, a religious leader, someone who's highly influential in a traditional belief system rather than the scientific system. And lolu mode isi sometimes the religious arrogance binga hamne mola de wahne niku ñuul la julit la wala Christian la. This COVID-19 is not for me. This COVID-19 pul tubabi la, pul Chinese la, right? Man Gambian la, mange juli 5 times a day. Mange dem church all the time. Mange gene sarah, mange defli. So this COVID-19 is not for me. Failing to realize whether julit nga or not, according to the laws of nature, disease be spread. Religion munu sidara, nyan munu sidara. If you happen to go pul topoto jisa sohla for hamne, infections yang fa already. Disease bangi present already. Lolu nyan munu la say gene, juli munu la say gene, dara munu la say gene. Scientific, realities nga hamne non la disease be they transmit from one individual to the next. Tenga happen to be in that space. That's how you're going to get the disease. Munga ame the contraction. That's how you become an active player in spreading it. So if we are able to, when things like this happen, you gather people, not only politicians, because a lot of all this going on, where are the politicians? They're very influential in Gambia, right? Where are the political parties sensitizing, taking a role and not putting any message out there, politicizing this event, but rather gathering the facts from scientists, doctors, researchers, coordinators of this, program, pull new make sure So what I'm not seeing, my influential, active people who are respected in our communities, armed with the facts, and then not compromise on the reality of speaking the truth and the facts. Gisuma law enforcement, right? I've seen and heard a lot of money has gone into the country, right? Gisuma, for example, the National Disaster Management Law being a hamne passnenko, or there was a draft in 2008. I don't see any leadership control. What I'm hearing, my nurses and the community and the doctors, Red Cross and people who are on the front line struggling, right, to put things together, trying to save lives, but gisuma the leadership of the country by law. So bugana lal fofu rek later on. But dama buga participate from an activism point of view. Pour one in what is happening in our country at this is be all of the time that we have had.
No, Babu.
Past few months.
Babu, we get that. From the lunyo jema def moy to impact on the people on the ground. I mean, we will find a platform and hold the leadership responsible. From then we are just trying to get the expert or the experienced people. I mean, punyo muna impact the people on the ground for now. But we'll get to that. I mean, all the points you raised are valid. It's just for the program.
Yeah, so my name.
Wow.
We gotta understand all of these things are coordinated. Right? They're all coordinated. It's pointless even to tell people certain things. You tune in, and for example, when you need in certain circumstances for law enforcement to happen, that is a relief to the Red Cross. That is a relief to the hospitals. That is a relief to all these experts. I know them through. So we cannot really negate the fact name leadership so amutesili and concrete leadership according to the law, and for the people to be sensitized on the law and in this situation and what they need to do. Then what will happen when we're just going to be chasing our tails around. Lola Monica.
No, quite agree. I mean, quite agree on all those points. The manner to be effective, we trying to compartmentalize affair. We deal with this issue. I mean, we try to get the audience on the ground and the people influencers on the ground or in the diaspora. Influence this message to the people. But again, I mean, all those other points can be used on another platform and raise it up. Mr. Senghore is back here. Mr. Senghore?
Yes.
Okay. Yes. Did not from any Damabuga them into another question, and I would be really pleased if you can put it in Wolof or Johnala permission Satay. Man my pull ngay séré su la nexé nga la ka séré way ragal nané olof ba gina deugal séré bi way motax mën nga ñëw ci séré mën nga ñëw ci olof. The importance, the point here, Moine, how to protect the vulnerable, the elderly from this vicious and insidious virus. The gisning effect boom I'm already seeing Kilifai. But again, whole in the area of Sunji and Yitam and Sikirgi, it should be Nakala Famel. Mom lañ bëggoon laaj la ko boobaa nañ dem si docteur Marenah and nañ dem si Miss Jagne tam mu dimbale ñu si.
Ok jërëjëf Ben ngeen baalal man ak man séeréer la dégguma séeréer
Thank you.
li ma ci mën a wax rek mooy ne soo gisee unfortunately exécuté lii engrais indifference nit ñi ak denial moo tax ñu exécuté ba di bañ daal bañ a nangu ak tamit yaakaar ne am na ku doon wax léegi di wax ak last week bi
Babu
comme yàlla ak mbir yooyu loolu ak religion la loolu moom moo ñu yeggee fii parce que nit ñi soo leen waxee am na ñu bari soo leen waxee affaire yi Covid ak yooyu ñu ne man am naa yàlla am naa lii am naa yéene te yàlla daf la wax ne nga fagam ba pare suñ ñëwee si religion bi nit ñi man mënuma xam understand li jot nit ñi parce que su dee nga ne yow jullit nga gis Màkka fa nga xam ne foofu la ñuy dem li ñuy liggéey foofu la ñuy dem pour jaamu yàlla yi nga xam ne ci pila si la bokka ñu fiil nañ ne Covid am na dañ jël mesures yoo xam ne dañ war a prevent ba kenn demut aji yow nga nekk fii Gambia ngay wax naan dama gëm yàlla dama gëm lii dama gëm yàlla te yàlla dafa ne nga fagaru yàlla am na yu mu wax so lii moom mooy suñ problème loolu su fekkoon ne defoon nañ li ñu waroon a def kon tey duñ egga fii soo man li ma ci mën a wax rek mooy ne léegi ni ñoo mën a def mooy ku nekk na sol daalaam mooy li ma doon wax ci anglais si pour prevent si infection boobu disease bu mel nii da nga am ni pour force nga wax nit ñi ne naka ngaa moytoo naka ngaa fagaroo ñaareel bi mooy naka ngaa mën a dimbalee sa famille ak ñi nga sa dëkkandoor yi ñoom tamit ñu fagaru ba nga xam ne affaire bi du law léegi nag fiñ tollu mooy ñun ñëpp ku nekk jël sa sol sa daala ki nga xam ne moo dëkk sa kër nga def li nga war a def nga xam ne dinañ ñëpp dinañ mën a fagaru ñu nekk sa koñ bi ñu fagaru ñu mun nekk ci fële ñu def ko loolu moom rek moo ñu ci mun a génnee parce que affaire bi dégg la suñ kilifa yu bari ñaaka nañ leen ci Covid bi so yaakaar naa ne loolu moom ñëpp gis nañ ko so léegi nag liñ war a def jigéen ñi ndaw ñi mag ñi ñëpp dañ war a jóg te dinaa use opportunity bi pour tànk youth si Banjul youth si Banjul form nañ groupe ñoom seen boppa dañoo def sensitization tey ñëw nañ suñ office jox nañ leen matériel pour fumigation jox leen masque jox nañ leen everything ak radio yëpp dañoo dem def sensitization parce que ñoom jël nañ affaire bi seen responsibility ñu ne dañ bugg a Banjul ñu def liñ mun so yaakaar naa ne su community si yëpp defee noonu Serekunda youth si Serekunda Dipakunda Latrikunda Bundung yëpp jógee ku nekk def li nga mun yaakaar naa ne 19,000 deaths yi ñoo wax noonu duñ fa eega loolu nag rek a ko mën a prevent du ne hospital moo ko mën a prevent du ne garab moo ko mën a prevent li ko mën a prevent mooy ñun suñ boppa góor ak jigéen mag ak ndaw ku nekk li nga war a nga def ko ñu ngi wax masque da ngaa jël masque nit ki da ngaa jël masque instead of nga sol ko nga wàccee ko ci sa sikkim su nga ne yaa ngi sol masque su ko nga ne da ngaa nëbbu police yow yaa ngi nëbbu police te nëbbuloo feebar loolu mooy problème bi affaire bi yëpp leena la ñun dañ war a am discipline suñ boppa ñu xam ne lii feebar bi du ne yow kenn laa jàppal waaye daf laa jàppal lor ñi nga xam ne dañ la jegeñ sa mbokk ñi nga xam ne doonuñ ci dara so man daal loolu laa ci mën a wax daal ci suma olof séeréer yi.
Thank you. Bobu said na bu baax. Dr. Marenah, I mean, can you help us to sensitize us on what do we need to do to protect our vulnerable, the elders? From this vicious and insidious virus, and especially within the household. Dr. Marenah?
Yes, I think Mr. Senghore has put it very aptly.
Can you try the mic again? It was good.
I think I said most of what similar things. But Memenka Jakan, Willem, Nsimengeno, because Ngamen for okay, Willem, sign ya juve. A result all kata nyame. Near more tanta Gambia kono. May testing it. More nanika ning fenko ni sasa soto. And was Seattle back. Ndola Bankoka. Nia jube mol membijang. Adung mol menka fa ning sasa to. Wasitano as a more wuli one sinol. Not a mom fenke sign. Membatinam putalaje. O Willem Kumoti. Ninkul bitakan nyamen sign thing. Be futala mo wuli mo sifan o Gambia ni sa ko so nol men jubela sign wolem dol sim nekeno membat nan de futala woto because dol be ngalon naflo da dia be kala masi bolet so Mr. Senghore ya ko nyame to nyalem mon sa kunda nyanta fengol kala nyanta parela barin tol fanan fan jamal bi jen tol fanan menyanta kala cause man sa kunda ta be ke nola man sa kunda finita e ko moli mask dum wala menke nuoni da cover bari ni finita be do kan e kajelem mol ka mute bulo kono do ka ke e kumoto mol bu ka dum anyama dol fa e ka dunne dani be fuda police sorry bukadum ni police ni alon ko police be lorin dame e kadum ni tambita ya bonni ko tenke so wol ba dum kam police fengol because of police not because man la fi sasa soto so wolem problem wonti mol buka malo memo problem malo fo e man la fi ka believe ko sasa bijan or what the problem is ma understand but in mol nyanda mem miral e ka fengol mem befo si so kono e bulo ku e fengo dum mas dum e man nyana tala mol be siaren dame Wolbe, Pulke Tanka, can you Sasa Sotola? So when you talk about you will call Malafi Matakunda and Muta, Malafi and fine Malafi Nina, a monkey what? Yenda Memira, William, put it a canon in Sasa Soto. William Yenta Mira followers. Demalafi in Sasa Soto. So Memunekela signed them, Prunkana Soto. I don't go for Diamra and come for Fanam, William Go, Mo and I take Batandilla. Supporting Teo. Diningol. Nimol dia soro jama hanisa akadol batandilla but jama te batandilla. Diningol menka finti o mol menka diningol bulat ika finti kata football play kata tulungol banta. Nimol nada sokono. Tumadol ite sasa la fak. Italon nako sasa nyimbela. Bari ibama nyol imama nyol. Wolbina soto la ada bina problemo dila wollel. So mol nyenda wolle mira la baga. Because hanatara a made form of batandilla. Nita yasore teba dila menna asina wo batandilla. So nyenda wolle juwela.
Thank you, Doctor. Ms. Jagne, what necessities should be provided for healthcare workers in the Gambia?
So I think that the necessities that come to mind initially are proper PPE. So making sure that there's an adequate supply of face shields and face masks for the healthcare providers, gloves. I think like if they don't have the gowns or the things that go up, like on top of their scrubs, then at least that they have like the proper facial coverings. I think face coverings are so important to have. When I think of like PPE, like that is the necessity. I mean, I think having, if you want to talk about infrastructure and having hand washing stations, even if you have to have makeshift hand washing stations because of space issues or capacity issues, then that's also a necessity. But just making sure that the healthcare provider can actually protect themselves is very important. So making sure that they have the face mask and the face shields.
Thank you. Dr. Marenah. Oh, Dr. Marenah. Okay, Dr. Marenah, can you help us with that question too? Considering you are on the ground, you probably be in a better position. Apart from obviously the most important is to save them, save their lives. What other things do we think that they need to be supported with?
The healthcare workers.
The healthcare workers, especially the front line.
I think PPEs are important, but one which is harder to deal with is working conditions as well. A lot of our hospitals, some of them are newer. A lot of our hospitals, the EFTHS was built, I can't remember how many years ago, a very long time ago, did that way. It's not necessarily conducive for managing cases. You need to have space between your cases. The bed capacity, the majority of the time, our bed occupancy is over 96, 97%. So we're full the majority of times. So as we were saying, it's if we're going to fight it and we're going to stop people from catching it, we need to start dealing with it in better settings. And Mr. Senghore has talked about maybe having field hospitals, having other settings. Where you can have a larger area, you can have spaced out beds, people can wear appropriate PPEs, and then the risk of transmission then becomes less. When you're in a situation where there's 20 people in a ward and it's full of doctors and nurses, or as it is now, people come to A&E, the A&E is packed, there's people on top of each other, the risk of spread becomes higher. And you can even understand why people are reluctant to want to go to the hospital, because they've been there under a number of circumstances and they know what it's like. And people that are aware know that if I go there and one person in that place has COVID, then chances of the rest of us catching it is going to be very high. So, we need to start looking at the settings that we are being forced to manage these patients in. With regards to PPEs themselves, I think they are available. They're in the country and they're being distributed to centers as far as I'm aware. But the same thing as we say with the government about asking for help, when we need PPEs, we also need to make sure we ask for them, and also that we use them, know that they're available, and then use them appropriately when they're there. It's not enough to just sit down and say, I don't have PPEs and therefore I can't do X and Y. We have to try and do as much as we can to make sure we get it from the places where it's supposed to be and try and use them appropriately to make sure we give adequate patient care.
Thank you. Thank you. Mr. Senghore, I want to put these two questions together because we want to benefit from your experience, your international experience. First would be any plans. I mean, you have actually did point to it at the beginning, but we want you to elaborate a little bit more. Any plans for regional and international technical support on the way to our aid? And if so, when and what form? And I mean, probably you might not be in position to tell us exactly, as you are not government, but if in case on advice, I mean, what would you advise government today if you have the opportunity to do that? What happens in this in the region? What is happening in the region in terms of relief and support relative to Gambia? Are there any existing collaboration within the region? And the second part would be your experience as dealing with the Ebola relief in West Africa. The time you served with the International Red Cross and the Red Crescent. Can you give us a brief explanation on what is needed to be done from that point of experience? And again, what advice would you give in the case of asking for help and the kind of help and how it should be implemented?
Thank you very much. I think I alluded to it earlier on. It's all in the planning. When you plan based on scenarios. And the worst case scenario, you have to plan to think that it exceeds your capacity, national capacity, both in terms of human resource capacity, but also in terms of material and equipment and so on. And then you should have factored that part of it and know where you will go to. And this is exactly how we work at the Red Cross. When we do planning, we have phases, the first phase and so on. And then as you move along in the implementation, then you revise your plan. And here in the Gambia today, I don't think the plan that was developed, I'm sure Dr. Marenah will be better positioned to tell me where that was developed and is being implemented, whether it was revised or we have a revised plan or not, I'm not sure, but which is wrong, because normally once you start operation, halfway through or when situation changes, you need to adapt to the changing environment and revise your plan and look at the scenarios. So what we should be doing now, knowing and exactly that we have serious community transmission, and we know that our capacity is overstretched, with a lot of our health workers getting infected. And then apart from that, there is the panic. They are just human beings. I mean, you can't be working in an environment where you don't have enough resources, and then you have some of your colleagues getting infected and so on and so forth. I mean, that alone is a challenge. So what that tells us is that we need to be crying for help. And international solidarity exists. It exists when you have seen Italy. When they got to a point where they could not cope, they had to ask for help from China, isn't it? And Chinese came with equipment and medical teams to help them, and they helped them. And many countries are doing that. Now, why can't we do that? And this is what I have said a couple of days ago. I tweeted, I said, this is what the government should be doing. Now, from our part, in terms of Red Cross, this is how we do things. In the Ebola, I was coordinating for the International Federation Red Cross, the Ebola response in West Africa. And when Sierra Leone had problems of treatment centers, they appealed to the International Red Cross, and we got a field hospital that was sent to Kebba and installed there, and it was operational within 48 hours. And that really saved a lot of lives. But some of this request has to come from the government, and it has to be based on the needs that is expressed by the government to say this is what we want, because sometimes it can come from the Red Cross, but it has to go through the right person. Now, what we have done for Gambia Red Cross, I mean, we are an auxiliary. We are created by an act of parliament to support government in events like this. So we have developed our appeal based on the national plan, but we develop our plan together with support from Geneva. We have our own resources. We have not gotten a cent from government until today. All what we do in terms of ambulances, in terms of our operations and everything, we got our own resources from Geneva. We have so far about 1.4, 1.5 million that we spent. We are buying ambulances. We have 2. We are ordered another 7 that are coming. We are setting up a lot of things to support the government in contact tracing and doing all these things. What I've done last week was to alert our headquarters and say, look, we might get to a point where we may need field hospital, field testing centers, field isolation centers. I mean, I've warned them, and they're working on that. So let's see what's going to happen.
Thank you.
The only challenge, it could have been here if it were under normal circumstances. But the challenge we face today is that the whole world is facing the same problem. So under normal circumstances, like let's take Ebola. During Ebola, it was only 3 countries.
Yes.
So when we asked, within 48 hours, they were able to, the British Red Cross was able to bring a field hospital with staff and everything, and it was up and running. But today, they are all grappling with that. So we are trying to find a way of getting them one of the countries maybe that has more capacity that they need at home, that they can help us. So what I would suggest and advise is the government should now talk to their partners and say, look, the situation is getting out of hand and our predictions are this and our capacity is overstretched. Get us A, B, C, and D. And we need it yesterday. And if they do it, they will get it. If the people cannot send the experts, but they can send the field hospitals that can be put up. And then, our staff, what Dr. Marenah was saying was right. In situations like this, you cannot use the same hospitals that you use for normal patients to do these things. Look at China. China is an example.
Yeah.
They build a hospital, and many other countries, we've seen that happen.
Yeah.
Either they build hospitals or they do field hospitals where access and everything is controlled. Everything, the interaction between the patients and the doctors and the medical people is completely controlled. But you can't do that in the Edward Francis Small Teaching Hospital. You can't do that in Serekunda. Dr. Marenah can correct me if I'm wrong. But this is usual practice. This is normal practice. And this is what government should help people to do.
Thank you.
Thank you.
Thank you very much, Mr. Senghore there. Mr. COVID and mental health. What advice do you have concerning COVID and mental health as it happened since the dawn of the COVID-19 and the national emergency, the regulations and some suggestion of lockdown, the state of the Gambian mind?
Yeah, I think that's a great
taboo around mental health as we know it in the Gambia.
Yeah, it's a great question. I think that mental health in any situation is stigmatized, even if it's not COVID-19. I don't think Gambians have enough discussion around mental health, and I think that's problematic. But if we're just focusing in on COVID-19, I know that us as Gambians are very community-oriented people. So when you tell Gambians that love to be around their people, that love to go into other people's houses, just to, sit down and talk and exchange pleasantries, it's hard to tell somebody like that you have to sit in your house, you have to isolate, you can't do you can't do the things that you're so used to doing, so the things that you've known your whole life. So that can take a toll on your mental health. And I think that it's important to address it and talk to someone about it, someone close to you, and say, this is hard. It's okay. It's okay that it's hard. It's hard on all of us. We in the United States, we've been quarantining. I've been working from home since March in my house, not going to community gatherings. So I can completely understand if there's, if there's mental issues that arise from being isolated. I think us in the diaspora, we're having a lot of anxiety with the surge of cases in Gambia and the surge of deaths that, cannot be, we can't for sure say that it's corona, but we can kind of, assume that it's coronavirus. So I think that that's, it definitely brings us anxiety. We're not there. Our family is there. And we all have loved ones there that, we want to protect. So that also is hard on people in the diaspora. So I want to just say that I empathize with you for the people in the diaspora, for the people in Gambia. I'm definitely empathizing with you. I'm definitely seeing, the struggle that's going on there, and just saying that it's okay to talk about it. It's okay to, it's okay to not be okay in these times. And just say, this is a lot of stress. I know for sure that Gambians do not talk about like their stress and their mental state. So, just opening that discussion is so important. So I think that's what it is. I know that there's anxiety across the globe, but in Gambia, just to even open the discussion is important.
Thank you very much. Because we run out of time, but I want to put in some of these questions singularly to members of the panel. Dr. Marenah, I know you are not a child doctor or what is called pediatrician, and this question was meant for Dr. Ceesay, but she's not here, but you might be able to help because it's a very important question that we might need, and your experience might be adequate enough. And if you can put it in Mandinka would be great, or any other language a local language more comfortable with. Could you please address, based on your experience or knowledge, on with babies and new mothers infected with COVID-19 and their chance of recovery, what expected mothers should do right now?
As you say, it's definitely outside of my field of knowledge. I mean, just looking at the numbers that we're seeing, there are some young children who've got it, but majority of them have been relatively fine. Of course, it brings its own complexities if a mother tests positive, because having to isolate them or take them to a treatment center, then you likely have to take the baby as well if they're a breastfeeding mother, and then think about having to test the child, or vice versa, where if the child tests positive, then you have to take the mother into account. And I think it's you need to have a whole setup. I believe that the pediatricians are working at the treatment center, at the sanatorium, to try and make sure that it's a conducive environment for young children, where at least have an area where they can look after young children, donations of toys and so on and so forth. Just to make sure that, we do cater for the fact that there may be children there, or people mothers who have to go with their children. And a similar situation for even those who just have to be quarantined. Some healthcare workers have young children at home and they've had to go into quarantine, and you have to start thinking, what happens to the children? Where do you leave them? Who looks after them? Do they go with their mother? A lot of social issues the things that we often don't maybe look at enough, like we say, the mental health and the social side of things, really needs to be taken into account a lot.
Thank you very much, Dr. Marenah. Okay. I can see, but I would rather just stay on the phone, Mr. Senghore, just in case. I don't know what my serial guys have done, but he seems he's coming out better. Did you consult your Fula Marabu?
Yes.
Yeah, it must be. It must be. And Mr. Senghore, again, we had the lockdown before, the closure of borders and stuff like that. How effective it had been, or it would be? What advice do you have around that? Another follow-up question on that would be around the mortuary, what we call death house in the Gambia. I think the street is called Cable and Wireless, or the street just alongside. We do see members of public congregate around the mortuary and so on. What would you advise? Is it advisable to close it for members of publics, or put a kind of a coordinate, coordinate, keep it zone free from interference?
Okay. Thank you, Ben. Look, in terms of the lockdown, I had my opinion. My honest opinion is that we've had a lot of measures that were put in place, but they were never followed through. I always say that it's a shared responsibility. Government, it's the government's role and responsibility to declare a state of public emergency, and it's the government's responsibility to come out with the regulations and guidelines and so on. And it's also the government's responsibility to enforce it. But it's also the responsibility of every Gambian to follow those guidelines and to protect oneself. Unfortunately, we had a failure in terms of one from the enforcement. What I saw today, I was driving into Serekunda from the office, and I saw the way the police intervention unit were all over the place, closing markets and enforcing this and doing all kinds of things as they did last night. I said to myself, I wish this was done from day one, when the first state of public emergency was declared. And that's very unfortunate, because if we had done that, we would not have gotten to this point. We may have, but at least it would have been less. So really, that's a lesson to learn. And I think this is where now both the government failed and the people also failed. So it's a little too late, but I think we still have to pick up the pieces. And the only way we can pick up the pieces is we all come together and make sure that we put a lid over the spread of the virus. With regards to your question relating to the dead house or the mortuary, I think what I said earlier on was that one of the reasons why we doing safe and dignified burial is to cut the chain of transmission, to reduce the transmission. And family members should help us to do that, and help everyone help themselves to do that. And the only way they can do that is that to reduce the numbers that go out there wanting to see the body or to serve or to do other things. We have to know that we are in an extraordinary situation where it requires sacrifice from everyone. And to come into that, because it's no longer the time where there's a funeral that everybody goes. The best thing is the close family members can be supported to be part of the funeral, and then the others, they should avoid gathering. If you can call, I think everybody will understand, or you just walk in, walk out, and extend your condolences at the house and avoid gathering. So for me, it's one side, the government or all of us who are doing something, but most importantly is the family members and the population that should help themselves and help us as well. Thank you.
Thank you. Before we go to the last question, we are almost at the end of time. Babu, do you want to come in before we move on to the last question?
Ben, thank you. My panel Jerejef, and especially contributions in your def as can be. I still want to focus on the problems pertaining to the management of this COVID-19 pandemic, epidemic in Gambia. I'm going to like a few questions, right? If it is possible, to Kini, Mr. Senghore, especially. My name is Senghore, considering swing on balance. Swing tradition, as far as funerals, are there any guidelines if people want to go ahead and have funerals? Are there any plans on Nakaling Kora Defe to the most safest manner? Benga hamne funerals dina social distancing dina sibir funerals, right? Light crowds doing gather, but then yet still people can pay respect during funerals. Anything like that?
Well, I mean, that's a very difficult question in the sense that even the past couple of weeks, we have seen a lot of funerals that have happened. And you can never, you find it very difficult to control people or to social distance, even if they wear masks. And I would hate to say that, but I think large or funerals are becoming conduits for transmission of the virus. And I think we should do all of us a favor and understand the circumstances. So in my view, there is no creative way of or a shortcut to organizing these things. I think the few that can be there, we normally create that opportunity. If, for instance, the burial is taking place at the graveyard, at least few people can be part of it, but at a distance, and they should be wearing masks and staying at a distance and to pray for the person. So if that is what you're talking about, I think that there is always provision for that. Even in some instances, if, for instance, somebody traditionally or religiously wants to wash the body and whatever, I mean, we can help in terms of providing PPE and the guidance, make sure that the wearing, putting on of the PPE and getting it off and how you do it. We do that. We do help people to do that because we also try to, as much as possible, to respect the culture and the tradition as well as the religious wishes of some families. But gatherings, I don't think it's advisable because I think it's very difficult. We have seen some funerals where even people have been giving mass at the entrance. But, still, when you get inside, you see something different. So for me, really, my honest view is, I think the less people, the better.
Yeah.
Can I follow up on Lolo? Thank you so much for that. That's the ideal situation. The best my pull new sacrifice some of our traditions and cultures during this, difficult times. But we want to take a look in the young lady here. We don't want the emotional stress. Nyon ditch lumin sinyon. Fini in America, you go to the hospital, you're COVID-19 affected, and you get symptoms that progress prevailing conditions, and obviously may lead to death. Most likely, family doing any contact akio. Doing their last goodbyes, doing anything to come close to you, and then find the potentials of at least you make a spreader of COVID-19, be either to their families or to their communities or at work. The reason with Wahali is because when we look at essential businesses, when the government says, okay, everybody can shut down, but then we have essential businesses or people that do essential work in this type of epidemic, well, there should be guidelines on essential businesses. How do they actually practice safely to do their job? Is there anything that the government is doing other than just announcing, oh, you get lockdown, but essential business, you go back to work? Is there anywhere or training you have your business owners in the front lines too? Because not only nurses in frontline workers, but in times of epidemic, people have to find food. People, there are certain businesses they're important to the economy, because what we don't want in an epidemic, more to lose lives and then at the same time collapse our economy. Right? So I find like a double disaster. So Lolumata malakte see if funeral be don't you guys think it is important to you educate in situations where we cannot avoid gathering? This is what you have to do. If we're going to issue you some kind of a certification training, because COVID-19 is here to stay. It's not going to go away next month. It might be here until next year. Depending on how a country manages the situation, it might for the next 5 years, the new effect, right? So Single from a long-term strategy and the new normal. We have to educate the people, but we have to educate them at the grassroots level scientifically. That way we don't have clashes of the minds, we don't have clashes with our culture, right? There's nobody to explain it, nobody to lead it, no guidelines pull one in lila, and people appear like as if they're breaking the law or they don't respect guidelines they are none whatsoever. So on those concerns.
Okay, I think you're absolutely right. I think your point is valid and it's to the point. Under normal circumstances, when you provide regulations or things, you have to accompany with guidance in terms of how people would have to behave and things like that. Now, there are some. For example, you can see even banks in the Gambia today. They have developed a way of social distancing and the way you go. If you go into an ATM or if you're going into a bank, you have to wait outside and a number of people going there. But unfortunately, some of those things initiate their own initiatives. So on an ideal world, you should have an institution or the government that really develop that and ensure that these things are followed through and people are provided guidance. And I had that experience because you know that I was National COVID Coordinator for a short while.
Mm-hmm. Yeah.
And when I was National COVID Coordinator, that's exactly what I attempted doing. And I engaged both Birkama Area Council and the Kanifing Municipality. And this was exactly what I was doing with them, trying to help them how to decongest Serekunda market and Birkama market and what guidelines should be put in place and the like. Mm-hmm. And unfortunately, we did not go through it because I left. But that was exactly the aim. The aim was to really start with that. But for all other institutions, businesses, and so on, work with them as a coordination secretariat and provide them with the support and the guidance on how they do things. So this is where, and this is how it should be. So today it's not like that, but hopefully the new coordinator might take up that responsibility. Thank you.
Thank you. Thank you, Mr. Senghore. I think Babu spoke about culture, but I would advise you again, one culture you should not abandon is putting the fullest as your mentor, as your you have seen the difference it has made. I mean, I would go to Ms. Jagne for the last questions, and I will pose the same question to both gentlemen, and Babu would have his final words before we close the program. And the question would be for Ms. Jagne. What next? How and what kind of support could the Gambia diaspora offer to all the to all the efforts going on to cope the COVID-19 in the Gambia? What would your future, contribution be for each of you? Diaspora that was meant to be to fight this COVID-19.
Yeah, absolutely. I think what Mr. Job just said about looking at this long term and not thinking that this is going to go away very soon, like next week or next month. It's not. It's going to be here with us, and we need to find a new normal. I think that is absolutely true. And so we should start planning out for the future. As far as the diaspora, we're here. I can speak for the young public health professionals. We're willing to help if it's like helping with public health messaging, getting word out and desensitizing in the rural areas and maybe not in places where there might not be these facilities for them to like stream us talking right now, like thinking about that, further planning, looking at risk populations that have underlying health conditions, any way that we can help. I think I can speak for everyone, every young adult that's in diaspora that knows public health, that has studied public health, that says that of course we want to help. Gambia is our home still. So I think just knowing that we're here, the same way that we were reached out to join this panel is the same way you can reach out to us and say, we need help with this public health messaging, or we need help like showing what to do at a funeral or how to train like the people. I think we can definitely provide support, even if it is in a virtual way. So I think I can end off with that. I also want to say that, we've already started crowdfunding for masks. So I don't know who I can leave the information with. If you want to donate, or if you want to be the recipient of a free mask, you can reach out to us. We've already started that, providing the PPE. We have people that are making masks the right way with the right amount of layers, following the WHO guidelines for PPE. That is happening, we're not in Gambia, but we are, trying to supply the mask. And then there are places, I know for sure of InnovaRx in Gambia that, have the public health messaging, have the PPE available. So I think just knowing that we're here, definitely here to support, we're all in a difficult time right now, but we don't want to see a country as small as Gambia that can avoid such pandemonium, go into it when it can be completely avoidable. Like, we're small enough in Gambia to avoid it. So yeah, if there's any way that I can leave you that information.
Yes, you can leave. Yeah, you can leave on this link, and you can do it to Nday or the other people that contacted you to invite you on this channel, and we'll see what we can do among ourselves.
Yes, I will do that. I'll type it in right now.
Thank you very much, Ms. Jagne. And next time I will put you on the spot and speak Wolof to you.
Okay, no problem.
All right, thank you about that. Thank you. And Mr. Marenah, Dr. Marenah, and Doctor, for the same question, but as we say in the thinking of the long term, what recommendations would you make to your to your colleagues on the ground to try to harness the human resource in the diaspora here, not only the material resource, but the human resource and in the diaspora? We have suggestions here. The last program we had, Dr. Kadi Barrow, have suggested that some trainings can be conducted from the diaspora for to prepare the capacity or refreshment or whatever you call it. What are the recommendations would you make to your colleagues? And answering to the question of what next, and how do you think that diasporans can help in this effort and fighting the COVID?
Sorry, no problem. I just got cut off. I didn't hear your question. I'm just joining.
Okay. What I was saying is, as the question of the post earlier is what next, and how can we help the diaspora in the fight against COVID? And as we talking about even the long term, not only the short term, do you have any recommendations that you can make for your for the area you work in, Edward Francis Small Hospital? As we had suggestions here, in fact, people had offered our last program, Dr. Kadi Barrow, to say that some of the training needed can be conducted from the diaspora here through video links and so forth. And as Ms. Jagne just said again, that they are doing some of the other things, and they would obviously love to be coordinated, because there are a lot of Gambians in the diaspora are doing, and they want to do more. How do you harness this human resource?
Yeah, I think that's it's important, and as you say, as Jagne has said as well, it's we're going to change to a new way of doing things with this COVID, and not only diasporans, but the Gambians who are maybe even stuck abroad who can help. Human resources is an issue, and we have to see how we can capitalize on the current situation. Training can be done, but if we're going to rely on the people here to do the training, then it will be small groups at a time, and also we might not be able to reach as widely or as fast as we want. So like you say, things like that, having teaching online, anywhere that has a projector or a light screen with an internet connection, we can gather people, or even people sitting at home with their computers or their phones on a meeting platform, where they can then learn how to do various things. Certain things, of course, need to be taught in person, but a lot of things, the principles, can be taught that way. And I think that's definitely one way where we can get input. Of course, crowdfunding and trying to source PPEs and things that may be needed. As we said, we have to prepare for a worst case scenario. And do we know whether what we have is enough in case we get to that? So it's always better to have more than you need and not need it. So I think helping from that point of view is also useful.
Thank you. Thank you. Thank you, Dr. Marenah. And for the members of audience who don't know, Dr. Marenah is another good painter. He never said that here. I don't know whether he remember. We used to do some in we had some in London. He's a good painter. When we get out of this COVID, I think contact Dr. Marenah. Thank you, brother. Mr. Senghore, and especially your experience in coordinating, and both the Red Cross and the National Health Service, for that matter, for now as in emergency and for the long term, how can we, not only the material resources, and even the material resources is not exhausted in the diaspora, but especially the human resource. I mean, what recommendations would you make for the government and for the diasporans, how to organize themselves, where to reach, how to do things better in order to effect, especially now, the to fight the COVID.
Thank you. I think the previous speakers have said a lot in terms of the support that is required, but all I have to say, as alluded by Dr. Marenah, the issue of capacity. I think already in the country there are a number of doctors and health professionals who have come together and have been very supportive, especially the elderly doctors who have retired, who are sitting here, have been very supportive in the past weeks. The likes of Dr. Cham, Dr. Jack, Dentist George, and Dr. Njai, Ramunjai, and the rest. I mean, we have a group that has been working behind the scenes, supporting the Minister of Health in terms of developing some of the guidelines and so on. So I think the same can also happen if the professionals out there in the diaspora want to help, can contact me and I can put them through to the national coordinator for them to be providing advice and guidance in some of the specific areas, or generally if they want to help in any way. I think we need all the capacities, and I know, having been working outside for a couple of years, I know that the Gambia has a very good human resource base, even though they are not in the country. But if we are able to harness all those capacities out there, we should be able to make headway. So through your good source, I think you can coordinate and get in touch with me, and I can put in contact with the national coordinator. If for anything in terms of the Red Cross, I mean, we are also open for, I mean, we've had a lot of support from the diaspora. And even as I speak now, there are a number of offers to support some of the volunteers. You know that those youngsters who are doing the burial are volunteers. They are not staff of the Red Cross. They're sacrificing. So I really want to thank those who have come up and supporting them. Apart from the burial too, I mean, we have a fumigation team that has been going around fumigating houses or household where there have been COVID positive, or institutions. So, and this is also done by youngsters who are volunteers of the Red Cross. So in passing, I really want to commend them and thank them, because they are sacrificing when everybody is hiding there, working day and night to do the most difficult job. And we have a lot of support locally and also from the diaspora in terms of helping them with whatever support in terms of making their work easy. So thank you very much.
Thank you. Babu, do you have your final words before we get to the closer?
Yeah, saying thank you to you. Thank you to Mr. Senghore. Kini, Mr. Marenah, and is it Aja? Momtam, and everybody else who was on the panel, educating, because educating our people and getting educated too based on their feedback, and all of us working together as a team, you know, but now a couple of things to direct. We know there are laws that exist, Suleiman, to manage this. And there was somebody that mentioned Hamza Senghore or Marenah, Mr. Marenah, that said something about, you know, lack of resources in and it could be that resources are sometimes, but there's a delay in communicating. You know, there's a delay in coordinating, and part of swing society will maneka di just moine nyaka yar nekut only nyaka yar nekut hamulo wahin wala anything nyaka yar moy nga read dara understand ko be pare nga ne doko def nyaka yar moy nga dem school be pare janga be pare ñu ne la lead of the ray be pare ngay test ndax lolu dina la ray ou du la ray be ngay nek an active participant pour ray lu ñeneen yi lolu moy ñaka yar. We need to change our philosophy of thinking. Sine, we should be less interested in nakala nit di wahe, but rather message be more. If it is factual, focus more on lolu, because munulo gena janga doctor bi, munulo gena janga coordinator bi, munulo gena janga nurse being tech fofu nonu pour mu deal with li, munulo gena janga ki nekk si situation bi ñu nekk government bi nekk si government bi wala si position as a minister or nga nekk si national assembly bi, you're not in the thick of it. So when you're in the thick of it and you're told on radio, on a newspaper, social media, forum bi ñoo am ni right now, yow sa janga sori wut si dara, understand loolu li ñi di wax. What you owe your country, patriotism bi nga owe sa country is not yara deku. Patriotism being a osa country is not ignorance. Patriotism being a osa country moy to listen, follow the guidelines in law, and you execute it to save your life, your country's situation. Because tay halis bi ñoo dugal si COVID-19 because of yara dekubi ak banya deklubi ak formulating our own minds. That's money we could have poured to get our hospitals much better. That is money that we could have put in our economy, create more jobs. And there's a lot of evidence all over the world. Countries with better leaders and managers are the ones who are going to make better use of the both situation, where they will be able to keep their economy going, right? Creating jobs, continue the safe and jobs, and they will still be able to save lives at the same time. But Lolu Yarak Teginla at the highest level of authority. Fofula mo starte, mu travel all the way down to the last Gambian bijuro. So we have to be able to speak truth to power. We have to be able to speak truth to ne. So it is okay for me to offend you. Better 5 minutes to save your life, save your community's life, save everybody in the country their lives. And you should be able to be fine with that uncomfortable, occurrence being a mom la tech at this point. Wahuma lako because the mala saga, wahuma lako because the mala has, wahuma lako because the mala help did it. The last point, technology. Technology in the rest of the world, diko you see pandemic bini, it's not people just invent technology for fun. People invent technology because it makes sense. It makes sense, and technology bobu saves life. For example, 1025 number bobu right, should not be the way it is run today or managed today, right? It should be a coordinated effort in technology, call center softwares, right? All the way to the hospitals, connected to the ambulances, connected to the council that manages, so that if a coordinator can use data in real time and make decisions as to Mr. Senghore, you cannot lead in this epidemic or pandemic, amulo real-time data so that you can shift and know when to deviate from plan being a def. What plan bobu no tamit, we should not be a country bohamne, swing jiko ak swing attitude, see li moy nyaka yar bi madewa, at nyaka tegen bi moy we right write laws. We are very good at it. We write all these policies. We are excellent in that, right? You want to know how smart Gambians are? Go to the things that they write. But when it comes to implementing, fofula problem bi day neka, fofula ñaka yar bi day neka, fofula suma nit ñi jaraluñ mako, suma deka jaralu mako, right? So what we should be able to have and do te mu neka suñ jikko moy ne, when we write things, we don't wait until game day to see that it works. We should be able to be prepared for a pandemic every single year and then get into a mode bo hamne su fekkene ni ñu ngi suspect ne dara nge xew ci aduna bi or dara xewut sax, but we just want to save more lives and then want to be in control. Our leaders should be able to test things that they write on paper and test it in real life before even game day. No. So where you are vulnerable, where you need opportunities fixed, where you need to tweak laws, right? Effectively be a leader. And is what is bringing us to Finnekanite, and we need to change our mindset and our attitude as Gambians. The rest of the world doesn't really care about our cultures, our tradition. February doesn't care about that, right? Nobody cares about the amga halis, amga kerbu rafet na yai imam, yai li ak yai lele. The point more is saving lives. They change Jacobi to do that and to be patriotic, not to stand with February, the rare, but stand with your fellow Gambians to protect their lives and be a good citizen. Lolu moy
jërëjëf Babu foko daanele nonu fala ko bëgga ekate. And one thing la bëgg a wax ne ñun Gambia luñ war a xool tey mooy ne lii na nekk natu waaye na nekk natu boo xam ne dañ see amee ngëneel bi mooy delloo Gambia boo xam ne moom lañ xamoon moom lañ amoon te tey luñ mën a xeex fii lan moo ko mën a xeex mooy information and communication. Gis nañ dëkk bu ne mel ni Taiwan dëgg la bu mën nañoo wax seen communication and information moo ko xeex. Xëj na dëgg la am nañ technologie boo xam ne Gambia amuñ ko waaye ñun tam Gambia am nañ loo xam ne moom la ñoo puugaroo mooy ne suñ nit ñi ndig bu ñooy am suñ independence suñ nit ñi lañ waxoon ne moom lañ yaakaar pour independent bon nañ leen dellu si nit ñooñu nañ leen dem jël aada bu baax boo xam ne moom lañ amoon ñu toppa ko pour waxtaan suñ biir pour génnee loo xam ne moo nekk suñ biir waaye la fa njëkkee fu mu njëkkee mooy suñ kaw si boppa dañ am personal responsibilities pour jël te personal responsibility yooyu mooy dox suñ community bon suñ taxawee luñ war a jël suñ boppa jël ko suñ kër yi mais soo mu am si community bi xam naa ne bu boobaa bon dinañ win xeex boo xam ne moom lañ am suñ loxo te Gambie nañ fi jógee nekk Gambie boo xam ne utee na Gambie démba te lii àddina bi yëpp la laal te fu mu duga dafa wécci fu mu duga dafa des ndax ñun nangu nañoo jël wéccit bi mu nekk wéccit bu baax amen ndax dañuy jël wéccit bi mu nekk wéccit bu bon moo tax ñu ngi oote Gambien bi sa boppa njëkka nga toppatoo ko gëm ko ba pare nga taxaw si loo xam ne moo war a taxaw sa community sa njaboot ñu jàppa si njaboot yi nu ñu ko war a jàppee dugga si community jàppee nu ñu ko war a jàppee am dox yoo xam ne dañ ko doon doxee nga xam ne ku ne da nga am position of leadership ku ne bàyyi si kër da nga am responsibility ku ne ndey si kër da nga am responsibility ku ne mag si kër da nga am responsibility ku ne rakk si kër da nga am responsibility noonu lañ ko amee suñ community am alkali am imam am priest am géwél boo xam ne ñooy taxaw di génnee kaddu yi waaye tey dëgg la lu tuuti lañ am si technologie waaye luñ si am lu tuuti mooy télécoms bu ñu am at mobile phone bu ñu am bon mun nañoo jël loolu jokkoo ko pour egg foo xam ne yeneen réew yoo xam ne ñoom lañ génnee wala ñoo xam ne tane nañ tey fa lañ jaar moo tax yëpp tey luñ fi mun ti def ak luñ wax yëpp mooy duñ mun a am luñ bugga te su nekkee ne taxawuñ aar suñ bopp te nu ñuy aaree suñ bopp mooy ñu oytu te oytu bi mooy jël responsibility bi mooy jël leadership bi mooy taxaw foo xam ne moom lañ war a taxaw def ko mu njëkkee suñ bopp suñ ko defee dinañ am that community di sëñ ak tam am na leneen luñ si teg mooy that community spirit luñ xamee Gambian bi community spirit bu ñu xamee woon Gambian bi nga xam ne su demee benn xarit gisoon nañ fi étiwal bon ku bugg a wax ne man mënumaa toog wala mënumaa génn dégg la am na ñoo xam ne seen liggéey sax nanguwuñ ñu toog am na ñoo xam ne seen soxla nanguwuñ ñu toog bon am na fu muy toolu bakken comme que gëm nañ ne suñ génnee suñ bakken mun na see des bon suñ soxla buy war a tax ñu génn war naa nekk soxla bu jàmp loo xam ne ñu ngi koo jëflanteel buñ nangu masla yàqal ñu masla dañ ko indi suñ biir pour mu defar ñu bon ñun waruñoo nangu masla yàqal ñu masla ne su ma demut si dëj bi nii lañ ma xoolee ne lañ maa xoolee déedéet loolu mooy masla bu yàq mun ne ñoo ekkati suñ téléphone bi ñu woote nit ki nekkul ne sa jëma mooy faj waaye sa xel mooy faj sa jikko mooy faj moo tax ñu war a jël suñ xel ak suñ jikko pour ñu faj suñ bopp waaye ñu génn si masla boo xam ne fii de suma sëyukaay la su ma demut wala suma sëyukaay doom la su ma demut nii laa dee déedéet lii xajut suñ biir xajut si àddina rawatina ñu Gambia nu ko fi docteur yi waxee ne luñ xayma yal na ko bu ko yàlla def waaye na fekk ñu xëy luy xayma su amee nekk na loo xam ne bon fu mu ne nii kër gu ne dugg na ko te demaguñ fen den na indi loo xam ne dina ñu yàqal loolal lu bari bon maa ngi oote community spirit boobu suñ responsabilité Gambien buñ doon community spirit ñu ëkkati ko te bëgg naa ñu jël community spirit boobu ñu sédd ko jël ko teg ko suñ dimbali si suñ healthcare workers si dara new si gis nañ fi Angleterre jël nañ bés ñu ne alxamis bu ne si ngoon dinañ génn tàccul suñ healthcare workers si dinañ ne rawatina ñoo xam ne ñu nekk front line loolu yëpp ñu ne la jërëjëf ne la waa ji jërëjëf jàmbaar ngeen at lépp dina def lu bari te suñ healthcare workers yi suñ front line workers yi fu mu ne ni toll nañ foo xam ne métti na nit feebar bi nekkul feebar boo xam ne dafay dal rek gaañ la waaye dafay dem si xel bi moo tax tam bokk na si loo xam ne ñu ngi koy woote mooy ñu jël suñ community spirit bi ñu mbuboo ko ñu ekkati ko mu dugg suñ biir waaye rawatina tam mooy ñu jóg suñ bopp nu ko fi baabu waxee in fact lii dañ ko war a politicize naka lañ koy politicize mooy ñoo xam ne dañuy dox si politique mu ndig la fa am ay bunta yoo xam ne moo gën a taxaw yoo xam ne moom la ñuy déglu mooy bunti aada bi suñ géwél yi tey xam nañ ne fuñ jóg dinañ leen dégg am na nu suñ géwél yi mun a jotee nit ñi te ñoom seen boppan ñu aar seen bopp mun nañoo wax seen WhatsApp groupe bi mun nañoo def audio mun nañoo def vidéo mun nañoo def leneen suñ imaam yi dañ am cër suñ priest yi dañ am cër suñ community leaders yi dañ am cër ñun ñëpp dañ am cër ñii ñooy influencers yi waaye ndaw ñu bari ñu ngee def lu bari waaye ñu ngee yokk ne ndaw ñi jokkante leen jël nañ seen influence social media tey seen jamono jël nañ ko mu njëriñ ñu taxaw xeex ko seen taxawaay bokk na si lu mun a xeex génne lii fu mu ne mbokk yi jërëjëf si loo xam ne moom ngeen ñëw amen si déglu bi si loo xam ne ñu ngi ko jàppa waaye duñ mun a jeexal wax bi te waxuñ jërëjëf ñoo xam ne ñëpp teewoo nañ fi tey ak ñoo xam ne itewoon nañ fi teewu fi waaye mu nekk ne fuñ ne ak ñoo xam ne bëggoon nañ fa teewoo te mënuñ fee teewee ndig liggéey buñ am ndig yéen ñëpp ñu fi taxaw tey yéen a ngi taxaw si loo xam ne xeex bi yéen a nekk si kanamam nekk si digga bi ñu ngi leen a ñaanal yàlla aar leen ñu ngi leen yàlla dooleel leen an ndam bi mu indil ñu ko nu mu gën a gaawee an moo tax ñu ne jërëjëf jëf yéen ñoo xam ne mën ngeen fee nekk am ñoo xam ne try nañ sax waaye line si nekkoon problème ñu ngeen a jërëjëf si ñoo xam ne ñooy radio station si at plateforme yoo xam ne yëpp bokk nañ si jàpp si lii waaye ñu ngeen a jërëjëf tam si ñoo xam ne mooy civil society loolu ñoo wax njiital boo xam ne jël nañ ko muy loo xam ne si laa bokk Elizabeth Sosé si nekk Angleterre si la bokk Ndey Jobaate nekk Norway si la bokk Maymuna Taal nekk Canada si la bokk an Cerno Ba nekk Minnesota US si la bokk waaye nag lii yëpp mënu soon a am su nekkutoon ne yéen yëpp jàpp ngeen si ñu ngi leen ne jërëjëf ne leen ne jaaraama an su soobee yàlla dinañ continuer di jokkante ak jokkalante ba am loo xam ne moom lañ bugga si réew mi ñu xeex jël ndam li si loxo amen si loxo naka feebar bi boo xam ne moo ñu amee du ñu gañe mukk su soobee yàlla Gambie na gañe mbokk yi ñu dellu si lu baabu wax ñu déglu ñoo xam ne ñoom lañ jiital si rawatina si ñoo xam ne si mbiri amen science bi la mu ñooy docteur yi ñooy coordinateurs at yëpp ñu jàppale leen suñu leen a jàppale loolu rek lañ mun a def aar sa bopp nga aar keneen lii nekkul loo xam ne képp am na ku si mun a mucc ku si mucc rek fekk sa morom daf la muccale mun ngaa def képp lan kàttan suñu yaay suñ baay mun nañoo toog si kër gi bañ a def bañ a dem bañ a dégg bañ a wax waaye ñun ndaw ñu génn indi ko seen biir moo tax ñu war koo xalaat jërëjëf bu baax amen kontaan nañ torop at si seen teew jërëjëf. Thank you guys.
Thank you.
jërëjëf.
Here are 5 ways you can help combat stigma and discrimination as we fight against coronavirus COVID-19. 1. Educate your friends and family that COVID-19 is not specific to any race, nationality, or skin color. 2. Do not associate migrants with the virus. In many contexts, migrants are healthy and key players in nation building. 3. Remind others that discrimination may lead people to hide their symptoms rather than seek treatment. This puts everyone else at risk. 4. Be kind, considerate, and helpful to others in these difficult times. 5. If you know anyone experiencing symptoms, encourage them to dial 1025 for free.
isi fam mako no foi si tanka kaja fo ning fatan fansola pour ka nyun corona jangaro kele bunda folo ela ka funyol ni la dimbayal kala mutandi ko nyun corona jangaro buka jibe e musi jumalati warande ibada banku jumaleto walla e bawlo la kuloro mu kurola jumalati bunda fulanjang ikanaje ko tamalal dam male ka ta nyun corona jangaro soto fanna jama ya itandi le ko nyin tamalal jama jato kende yatale andum ke kataku jamale ke banku do ko kono bunda sabanjam mol hakilo bulandi ko nyo kajafo ning fatam fanso satin nan ni nole fan fo modol sila kurango mabo puli kanata jararo la andum nyin si mobe dundi no mantoro konole bunda nani njam al nga bala fa nyoye nga nyoma koy bunda lulu njam nie molo meye atenyum corona kurang la mandar go sodo afoye 1025 command andum ite fenjola
ɗiɗo ko laawi joyɗi wawete rewde hara en aybinani en bonani fi haɓagol coronavirus ko adi kon jangine ɓeengure mon e weldiɓe mon hara on darani leñol ma koddigagu ko ɗimmi kon wata on ɓaɗoɗe kawtal leydi men jogiiɓe nde nawnare a wiyaka non kawtal leydi ɓe ko jogiiɓe nawnare nden tun ko tammiti kon aybingol jogiiɓe nde nawnare waɗay ha en wawata andude goɗɗo goo sino jogii sabu natima waɗay ha ɓe hersira te ɗum no bonani en enen fof naya ɓunɗum tambitoɗe moƴƴe andite ɗum koko feƴƴata joya ɓunɗum si tawi no woodi mo sikkitiɗon walla anduɗon jogiiɗo nde nawnare wata on ame nodde 1025 no yawiri
nañu booloo xeex xaajaarleeg xeet yi di xew ci jamono gi coronavirus xewee juróomi anam yiñ mën a jëfandoo mooy benn nañuy jàngal suñuy xarit ak jaboot yi ne coronavirus amut xaajaarleeg seen ñaar bu ñu tiiñal gan yi ak am di jaama réew mi ndaxte ci lu bari gan yi am nañ wérgu yaram te bokk nañ ci dooleel koom-koomi réew mi ñett nañu fàttali suñ boppa xaajaarle yi mun naa tax képp ku am màndarga jàngoro gi du feeñal boppam wala sàkku ndimbal te loolu mun naa indil ñëpp loraange ñeent nañu laabiir te ubbi suñu xol yi ci bépp doomu aadama ci jamono tolof-tolof yi juróom képp kuñ xam kuy wone màndarga yi wala am jàngoro gi nañ leen ñaax ñu woote ci 1025 te doo fay dara
Hello Gambia. Your television experience is about to be transformed to the next level. Enjoy amazing features with the new DTT decoder by XCAF. Watch television in high definition and excellent sound quality. Watch Gambian channels such as GRTS, QTV, Star TV, Paradise TV and MTA with one decoder, all for free. That's not all. For a monthly subscription of $510, you get 60 international channels from your favorite football leagues, news, African movies, telenovelas, cartoons and much more. Get the decoder for $2,040, which comes with free installation, 24/7 customer and technical support all year round, and 1 month free subscription for only $510 thereafter. Get the decoder at XCAF Gambia, located at Hendon Court Building, former Dream Park, Senegambia, or through approved dealers. For more info, call 446-1060 or 446-1061. The world is at your fingertips with the XCAF DTD decoder.
Blessed with the mighty Atlantic Ocean, fertile agricultural lands, and a strategic geographic location that gives an opportunity for a lot of people to explore and get into the business. Gunjur and the Gambia at large has experienced numerous shutdowns when it comes to economy, and especially this COVID time. Please join us as we embark on a journey where we explore different areas of our business sector, from agriculture, fisheries, and small business enterprises. Gunjur Business is in short called Gunjur Biz. This will be a platform that we will use to explore different business opportunities, especially for young people. We'll bring you on Gunjur Online all the business topics that is related to financing, operations, marketing. And we will use this platform to invite experts from different sectors of the Gambian economy and give tips and have a broader analysis of the general business sector. This will give us an opportunity to be able to discuss in a broader detail how businesses are affected when it comes to our environment, our natural resources being exploited by other people, but also how we can tap into the opportunities and also access capital, which is very crucial for the success of the businesses. But not only that, we won't stop at accessing capital. You know what else we're going to do? It's about the little operational processes that are needed in our business culture to build up cultures that's going to be successful. And that's going to be, most importantly, what? It's going to be sustainable for the success of the business. So we can transfer wealth. We can also transfer skills from one person to another to be able to live in a community that is thriving, a community that businesses, private sector, individual businesses nurture entrepreneurship and reward them. So please join me every week on Gunjur Online as we delve into all these areas of discussions when it comes to business success. This is your host, Abubakar of Gunjur Online. Thank you for joining us, and I'll see you.
Ntelen Albadi Yaya Sonko, also the founder of Sonko Dynasty. Nindima so mun kanana nte aning jali dinding wala Andreasti mbetarra papaje la programme to de akamenki Gunjur online radio to mbetari ko ko kachala je mbe jali yala ko fanan kachala je le anyama fan jali ya bota nyaadi le anata nyaadi le jalollo lamuneti molla society kono ndo be kachala je le mba kacala mandika kan wala de bari mandika kam moy lalu aning melka kan fono mbal buña la programme o nyinto je ni ala kiti tal ko dimaso be benna je